And we're live here on the third episode of the LA Shoulder Podcast. With me today, I have with me a very special guest, a fill-in guest, a guest mostly because I needed a guest. And his name is Andrew Kim. Here he is. He's a nurse. He's a merce. He wears man pants. And he's a special friend of mine. I love him. Andrew, welcome.
Thank you very much. I'm glad I'm a good replacement.
No, but a special replacement.
Oh, great. Oh, so a special one. Got it. That's very nice of you. Thank you.
Well, you know, it's either now or later, so now's better.
Yeah. Okay, great. Awesome.
Well, as I said before, I'm also the producer on the show, so sometimes I got to be twisting knobs.
Of course,
Is that going to bother you?
No, of course not.
Going to be okay?
You move, do what you got to do.
How's your mic?
Beautiful.
You happy?
It's awesome.
You comfortable?
I am very comfortable.
With us tonight, another special guest. Sorry to cut you off. Cassie G on the program. With us, Kassandra. We'll get to her in a moment. Kassandra G.
What's up, Cassie G?
Cassie G with us on the program.
Wicked G.
Cassie G. Say what's up to the audience, Cassie G. KG.
What's up?
How's your mic? Can you give me a little testy?
Hello.
Is it because you're talking so softly, or?
No. Can you hear me?
Oh,
There.
That's better, right?
Oh, wow. Yeah. Oh, wow. My God, I can really hear you.
Is that all right, KG? Take us away. Take us away.
What do you want me to say? I don't know.
No, I'm just kidding.
I need a shot.
Yeah. All right. So tonight we're going to talk about what it's like to be an orthopedic nurse. We're going to be talking about what it's like to be a scrub tech. And you guys are friends. You guys met at the hospital, right?
Yes, that's correct.
So how'd you guys meet? How'd you meet Kassandra?
Now I'm trying to think.
Did she meet you, or did you meet her?
It was right before the pandemic, I remember.
Oh my God, yeah, that's right.
Because I got assigned to our floor.
That's right.
And then you were one of my first friends, actually.
Yeah. And you were training, right? Mm-hmm. That's right. Yeah, we worked together in a room. I mean, I don't remember specifics. We just got along.
In the room?
Yeah.
Which room? The OR?
The OR.
Yeah, I'm trying.
Oh, like somebody's room.
Yeah, I'm trying to think. Who was your first case? Do you remember? But anyways,
it was total joints, or?
I don't think. No, she didn't start with joints, right?
No, I started with. Yeah, because I didn't even know how to scrub total joint cases.
Yeah, that's right. But we just had a good time. Like I like to mess around a lot. And yeah, that's I don't remember actually how. Yeah,
I don't really remember. I just know that I met you and June. Yeah. Shout out to June.
Yeah. You guys work together, right?
Yeah, we all work together.
But you started in the OR, Cass, right? You started in just orthopedics?
No, I didn't start orthopedics till like a year after.
So it was general?
Yeah, it was just like plastics, hand, smaller cases, GYN and stuff.
Yeah.
And then I went into ortho.
Oh, so you just do general, and then that way you learn the instruments and kind of basic cases, like basic surgical cases. Because if you're doing like an IND, it's sometimes it's less instruments, and then if it's a revision hip or something like that, orthopedic, total hip replacement, then it can be major instrumentation and a lot to remember and processes, right?
Yeah, I didn't go into ortho till later.
Because usually that's the process, right? When you first start, they don't put you right away to certain cases, kind of like general, move your way up kind of thing. And that's what I remember you did that. I know toward the end, you were all doing joints, all the ortho stuff. But before that, I was like, yeah, you're right, GYN. You know how they kind of build you up to that point.
What did you start out as?
Man. God, that was a long time ago.
What year did you become a nurse? Was that your first job?
No. So I started as a surgical tech in 2000. And then I was working and then went to school full time to become a nurse. And then I think I became a nurse in 2010. Mm-hmm. And then just transitioned over to the OR right away. Usually people after, school, they have to go to the floor and, But then I just bypassed, went straight to the OR because I was already there.
Is that what you wanted to do? You wanted to be in the OR?
I mean, it was an easy transition. You know what I mean? It wasn't. I was trying to go to PA school actually, and I didn't get in. One of my friends was like, "Hey, just apply to nursing." I was like, "I don't want to do that." And I applied, and I guess they had to meet X amount of guys or girls, and I just got in. And when I went in, everyone's like, "How long did you wait?" Because there's usually like 2-year waiting list. I didn't wait at all, and I got a lot of hate for that. But
which program?
it was one of the community colleges, you know,
for nursing.
for nursing,
for registered nurse. RN,
yeah,
right?
yeah, RN, yeah. And
How many years did it take to get through the program?
it took 2 years.
And did you have a bachelor's?
No, that was just AA.
So is that a high school? Oh no, you had AA.
yeah,
so
AA.
2 years,
to AA, and then I just went over because
and then 2 years nursing.
yeah, 2 years
4 years
nursing.
done from high school.
Oh no, that was so what I did high school.
So you had a different journey, but you took 4 years of education.
Completely different journey. I was going up and down. Out of high school, went to CSUN. 2 years I was trying to become a physical therapist, and then I just was having such a good time. I kind of fell off, and then I went.
CSUN is
Cal State Northridge.
Northridge, right? So it's not too far.
No, it's not too
That's
bad.
right up north, right?
And then you know, I was kind of messing up, but having a good time. I had a great time.
Oh, so you're partying in college?
My dorm room we got raided by the police twice.
It was like a resident hall.
Yeah, it was dorm room. So
Yeah.
I mean, I
so you
remember,
had like a whole floor of people.
yeah, floor people, but our room was pretty wild.
Well, you were the wild guy. You were the party guy. Hey guys, it's Friday. We took a test. Let's get together. We're gonna have a theme.
I don't even know.
You're gonna wear furry costumes. You're gonna be the elephant.
I mean, I
and
didn't
You're
even
gonna
know
be the
about-
cheetah.
I mean, it wasn't even like
I'm
that.
gonna be the gazelle, and then somebody's gonna be the hunter.
I mean, we had a good time. But that good time led to me like not doing well. So I was like, what should I do? You know, so I was like, I don't want to do this physical therapy. And then I found out about surgical tech. I was like, okay, this is medical. Let's try this. Did that. And then out of school, I got hired at Cedars. Oh, shit.
You can say that.
Oh, that's sorry.
It's okay.
I mean, I got hired at a hospital.
It's okay to say the facts of where you
some
had a
hospital.
job.
I don't know where. Some hospital. And then I was doing my internship there, and then they hired me. And then I was just working there. I was like, oh, you know what? I'm gonna go to school, try to be PA. So while I was doing that, I was going to school, community college while I was working, and then I progressed to.
So did you give up on being a PA at some point?
Yeah, because I tried applying like 2 years in a row.
So did you applied, didn't get in, then applied again?
Yeah.
And just waited?
And waited. And the thing is, the schools I was applying for, they needed a sign off from a doctor for their practice, you know. And the people asked, they didn't want their practice to be under scrutiny because they had to be certain amount of certain patients, HMO, whatever. So it was just hard to find someone to kind of like take me in, you know, to vouch for me. And
they had to take you under their wing to be a shadowing program?
yeah, like a shadowing program.
An MD?
Yeah, like they wanted me to find like a family
to be
practice.
a PA.
Yeah, so they wanted me to.
I would have done it for you. You just called me.
Thanks. That was,
On the LA Shoulder podcast, we will do that for you.
that was a long time ago.
If you subscribe, we might do that. I might do that for you.
I think you
just
probably,
call me.
but at that time you probably not even starting residency. Okay, but
I might have still been able to do it for you.
Oh.
Because I'm a doctor and I had a license, so I probably could have helped my friends out like
in
that.
2008.
No, that was too long ago.
Exactly.
Well, there's always another year.
Okay. Math probably isn't your great.
So have you given up on your hopes?
I right there. I was
You
like,
can come shadow me still. You can hang out with
you
me.
know,
I'll teach you stuff. It'll be fun.
I'm good now because I
I
love
used
my
to
life.
love hanging out with you though.
Oh yeah. Dude.
In the OR?
Oh.
It was great because you would just sit there and shop online and listen to music. And I would yell at you because the music wasn't loud enough. And then you would turn it up.
Yeah.
And then it sounded really good.
Yeah.
And it was fun.
Yeah. I had a good time.
And that's when I first met Andrew.
I try not to do too much.
But man, when I needed something, you got it right away.
That's the thing. You know, we should have fun at work.
Oh, we definitely had
You
fun.
cannot
early on.
You cannot not have fun.
Yeah.
You know, you can't take things too seriously, and you know, you get your stuff done, but have a good time.
Well, when you say that, it's doing surgery. So, you know, it's what I expect always is things to be done right, and all the steps to be done kind of completed in order, which is my responsibility. And I'm the one kind of directing all of those things in terms of how the whole like operation is happening even before it starts.
Yeah, of course.
Because once it starts, you have to handle all of that, right?
Of course.
So you were a circulating nurse.
Yeah.
So tell me what it's like to be a circulating nurse. What does that mean in the OR? Like, how does that interact with the surgeon? I'm scrubbed in. I'm doing the surgery, right? I'm obviously doing the surgery.
Yeah, of course.
What is your role with that?
So my role would be making sure the patient's good. That's what it is, basically.
How do you do that?
Making sure, like, positioning.
So let's say start. What happens as soon as you
in pre-op?
Talk to the patient.
So
they're
if
in
we
pre-op,
start
right?
from the
It's
very
a different
beginning,
area.
it's complete. So when we start from the beginning, when we check in the patient, talk to him, ask a bunch of questions, check labs, and of course help whoever the anesthesiologist is to get the case ready. And then from there, we have to go to the room and get things ready.
You talk to the anesthesiologist.
Well,
right?
no, the patient, right?
But you talk to the patient first.
Yeah, we talk to the patient first.
Maybe talk to the anesthesiologist.
Yeah, of course.
Definitely talk to the surgeon.
Surgeon to find out what you want, need,
But you usually know that anyways.
Yes, but
maybe confirming things.
Yeah, confirming, and then also getting the room ready. And that's
what
why
does that mean?
Getting the room ready is basically
you're mopping the floors. Get that room ready, baby. We're
medication,
ready to
your trays.
So you just get it?
Yeah,
you just know what to get.
I mean, no. Well, obviously we ask you, and
I don't know what to tell you.
But usually we have preferences.
Why are you asking me? Read the cards.
Well, sometimes the card's wrong. And sometimes, you might be like, no, I don't want that.
So you always talk to the surgeon, right?
Yeah.
And you should.
You should. Like, there should be a relationship. It's not like,
so too.
Hey, like some people think, oh, he's a doctor. I don't care.
Absolutely.
You wear your pants just like me. You go to the bathroom, you eat, I mean, what? I should be like, oh my God, because you memorize more stuff than me? Ultimately,
I know better than you, sir.
You went to school longer? Okay. But
right.
But
we're all part of the team for the patient. Like you said, the first thing you said was patient, right? So it's making sure the patient's good. Me too. It's ultimately about the patient. That's why we're all there.
Yeah.
So if our goals are not the same, if my mentality is not that it's patient first, it's about, hey, I got to get out of here.
Yeah, of course.
You guys got to figure it out. And your goal is patient first. That's going to put way more work on you.
Yeah.
That's going to strain the whole team relationship. So that's not good for anybody. But over time, what's interesting is I start outsourcing certain things because people like helping. They like being involved to a certain extent. That is, hey, he doesn't do it like this, he does it like that. He likes to make sure the head of the bed is like this. We have to make sure the head's secured. There's so many little detailed steps that somebody comes in, they're just standing there. You probably remember I used to say, like, and I still say it, if you're standing there and you're just watching me, you're not doing something that should be done, because I'm constantly moving. We should always be doing something. It's like a whole orchestration until I'm scrubbed in. So your role with all of that is first talking to the patient, talking to the surgeon, kind of confirming things. You and I work together quite a bit, right?
But the main thing is the teamwork between myself and whoever the surgical tech is. I think that's very important. Because like before that, everyone like, oh, the nurse is in the room, but you have to understand there's so many people working around making that surgery go well. And the surgical tech and myself, the communication, just the teamwork. We got to have a good
flow. Tell me what the surgical tech is. And
okay, so surgical tech is basically...
You were a tech?
Yeah, I was a surgical tech before. So that's why I think it was beneficial.
Before you were a nurse?
Yeah, and so I understood both roles. So I could anticipate both things. What
does a tech do?
So, I mean, surgical tech does a lot. And I don't think they get enough credit. Honestly, they don't, because I mean, they're there next to you, standing, anticipating your every need. They're the ones responsible opening, but I help them. They're responsible about
opening what?
Opening the trays, supplies,
sterile instruments,
just setting up the whole sterile environment for you, right? And I think it's very, very crucial. They're right there. And if you have a bad surgical tech,
what does that mean? That's a bad surgical tech.
Bad surgical tech, not ready, not reading the card, not being helpful, not wanting to participate. In the
surgery?
In the surgery, meaning like,
how do you participate in the surgery?
I mean, just
what's the best way for a tech to participate in a surgery?
So the best way, a good tech will anticipate, and the most important, details. Those little details are so important.
Details like preferences?
yeah, those preferences are so important. Like some things are still ingrained in my brain for certain people, just because
What can
I
you
did
remember?
it for. Oh my god, I don't want to put people on blast.
No,
But,
let's just say surgeon pepperoni.
So okay, look, okay,
Dr.
So
Pepperoni.
on Mike, he would wear 8.5 gloves.
Yeah.
And
8.5.
Ortho gloves.
Double.
And then triple.
Yeah. Always 3.
Yeah.
And then have an extra.
yeah. See, like
Those
not
little things.
not everyone does that, and the fact that your team would
She
know it-
remembers.
no, but that if your team remembers, that is you're like, oh, this is easy. The flow goes well. You know, nothing. Now, granted, if a crappy surgical tech was looking at a crappy nurse, you'll get it done.
Crappy nurse.
I mean, you'll get it
How
done.
dare you?
There are crappy nurses.
What does that mean, sir?
There's, but
Please
then,
explain
but,
yourself.
but where I worked at, we had a lot of good people.
Yeah.
So, but like, for example, you could do the case with anyone, but would it go smoothly? No, but you'll get it done. But you would prefer to have the case to go smoothly, right?
Always.
And when it goes smoothly, just everything works out, right? It's the good flow.
What's so interesting though is that can be so many variables to make that happen.
Yeah,
you know?
of course.
And so there's what's so interesting, especially as a young surgeon. I'm trying to get you to say it, Andrew Kim. Maybe if you would just
What?
say it, I wouldn't have to say it. But
Say it.
tell me the difference.
Say
And
it.
you both know the answer
Say
to this
it.
one. Is there's a difference between 2 different types of surgeons. There's many different types of
Yeah,
surgeons.
of course.
But there's a major difference between somebody who's just starting out
Yeah.
and then somebody who's been there for 5+ years.
Yeah.
Been doing the same thing.
Of course.
And if once you've been there for 5 years, you've figured out a lot of things,
Yeah,
like
of course.
maybe like 90% of
Yeah.
those things. So you know there's a major difference in interaction with those types of surgeons.
Yeah, of course.
Right? So tell me about that.
Okay.
What's it like when I was fresh and working?
So,
with you?
okay. Like,
Because
so
I wasn't bad.
no.
And
So-
it's like I maybe am figuring things out,
Yeah.
but as long as you're working with people,
yeah.
it's like, hey, tell me what I need to do, please.
Yeah. So,
please, Andrew, help me.
So I'll tell you. Okay. So,
Because I can do the surgery, but
Yeah.
there's a lot of things that I need help with too,
and then
with the whole system, right?
and the thing is too, a lot of times, I mean, for me, I never had a real set surgeon I worked with. I was kind of like the whore of the floor, pretty much. Like I go to a lot of people.
I remember you used
Yeah,
to say that.
I was like the whore of the floor because like I would go with anyone, but I did have maybe 1 or 2 that I would consistently work with, but everyone else, but usually the new people, like you, everyone that came in, they'd always put me in there, like just
I
someone
tried
new.
to. I put that on the card. I said Andrew
No,
Kim
but I know,
as
but-
my nurse, and they got mad at me
So-
because they said, "Hey, if you do that, then what about not Andrew Kim?"
Yeah, I know.
And I
So-
said, "Well, what about Andrew Kim? Just
But-
put him
but-
with me."
but this
people
is-
just it's sensitive. It's kind of like, hey, who's on the A team? Who's on the B team?
Yeah.
So we joke about that now because. Everybody's great. So
Yeah.
if you work with me, you're great.
Yeah.
It just means that sometimes schedules work differently.
Yeah, of course.
That's all.
But
Don't get your feelings hurt.
yeah, exactly.
it's
Don't
not
be so
personal.
sad. Yeah,
at all.
but the thing is, like,
But people take it personally.
from my experience,
But
like,
it's okay because you
Yeah.
pour a little bit of your soul out if
yeah,
you
of course,
are good
yeah,
and you care,
of course,
right?
It's just for my situation, like they always put me with new people, just because I was just easy to do things. I'm willing
Right,
to.
you could handle a lot of
yeah,
stuff.
because I was throwing the fire in the
okay.
beginning, so I've learned, and they know that I have tough skin. Like I could just,
I was just gonna say thick.
yeah, thick
skin.
thick
Yeah.
ass skin. I'd have a good time, like because I could understand the basics of what you want to do, and then I'd try to pick up details, and I spread the word, and then once you were kind of settled, and I was never there again. That's just how it is. They put me in. I mean, so many people. I don't want to name, but just everyone that came through. Oh, just put me in because other people are like, I can't do it. I don't want. I'm like, go. I don't give. Okay, whatever. Let's go.
Yeah.
We'll learn it.
Experience though.
Yeah,
Experience brings a lot.
Yeah,
to
that is probably
confidence and-
that was probably one thing.
But you got to
too.
go do it.
Yeah.
And then you're like, hey, I've done it. Now,
but
the
then
next
the
time
thing
it
is-
comes around, I can do it again.
But what sucks
But
is
then
like,
people that are good, they see that they're like, I want to work with Andrew
yeah.
because he's a good teacher and whatever he's doing, he can adapt and take care of a lot of different hard
but
situations.
let me
right?
clarify. Keep the bar low. I'm not.
You don't try too hard.
Yeah, I'm
so
not
he
that
likes to
great, but
shop,
thank you.
and he's really nice.
Yes,
and he comes on podcasts when he is.
Yeah, I'm the bench player. Okay,
He will
I'm the
hit that
last
double.
minute. Yeah.
He'll give you a single. Home run hitter is the next up at
Yeah.
bat.
But that was usually the situation every time. I mean, every time I never had like a certain person. Like you, toward the end, you had one dude, right? Like you work with one person consistently, And I never really, maybe, like I said, maybe 1 or 2 I would have consistent, but I was just, because they'll make me, go relieve the scrub tech and also relieve the nurse. Do that. Like I would have to just do a lot, but I didn't mind. I had a great time.
I remember you used to bitch a lot.
Yeah, right. He's lying.
I'm doing so much.
Oh, God.
You didn't complain too much about your body, though. It's not like your back hurt, though. You just complained about all the work that you have to do.
He's lying. He's a fucking liar.
It's only funny because it's a little true, Andrew. Like this whiskey brought to you by Shimatu Whiskey.
Oh, not a sponsor.
Not a sponsor. Actually, the other one, the more delicious one was Toki.
Oh, cheers. Let's
Suntory. Yeah, actually, this is not even firewater. This is delicious. Brought to you by Toki Suntory Whiskey, Japanese whiskey at its finest. And our sponsor on the show, Andrew Kim. Brought to you by Toki and Andrew Kim.
Asian approved.
Asian approved. Toki's Japanese whiskey. May or may not be from Japan.
Yeah.
No association with Toki whiskey, folks. But if you do want to tag our podcast,
let's do it.
That means.
It's worth it. Look at him.
It is delicious.
He's very.
Did we cheers?
He looks very nice on the camera.
Let me double cheers. Let's just redo it. Cheers, Cass. Oh,
cheers.
Cheers, Cass.
Clink.
Bloop.
No drinky because of Mavi. Little Mav.
You could, but you got pump and dump.
Pumpy dumpy. How are you doing with the pumpy dumpy? You don't do that much, right?
No, I don't pump and dump.
She's a good girl. I'm a bad boy. She's a good girl.
Mm-hmm.
It works out.
That's how it goes.
Yeah, that's
Balance.
That's the perfect match. That's how you're supposed to do it. It shouldn't be anything different.
So when did you give up jujitsu? Not Cass. You knew that I was talking to you, right?
So when I remember specifically when I did.
And I wasn't talking to myself. Yeah. I'm still coming back.
I remember specifically when I did.
Which day?
I got a cold. I
remember because I thought we were going to train and you said I'm too sick.
Was it when you came to work with a bunch of bruises?
No, I already had that before. That was already there.
I remember you came to work.
Yeah.
And I didn't even know about jiu-jitsu at the time. And I remember he comes to work. Yeah. He has all these bruises. Yeah. And I was like, dude, what happened to you?
Where were the bruises?
And he's like
on his hips?
I went to, no, they was like, you had really
on my arms,
on his arms. Yeah. They were huge. And I'm like, what were you doing? He's like, oh, I was rolling with stone. And I'm like, what? And then he started explaining to me what he was doing. Yeah. And I'm like, oh, wow, that sounds crazy. Yeah.
I mean,
is that when I used to choke you in the hallways to surprise you?
I remember that was fun.
And that's when you're like, I must learn something. No, I need to learn.
I love it. I mean,
and Camille thought I was abusing you. I think she came up to me and she used to hit me. She's like, stop bruising Andrew. Again, that's not a true story, Andrew. That's not even true. I never.
But I mean, your body. You became my bro. You became my bro because I tasted your ball sweat. Literally. Your balls hit my face, and I was like, "We're bros."
It's part of jiu-jitsu, folks.
I know.
It's every.
It was a little jarring.
Possible.
It was a little jarring. but I remember specifically when I stopped. It's like when I got sick, and then it was during that time. Like
I didn't do that on purpose. There is a position called balzania.
No, there isn't.
That is.
You lie.
I do.
Yeah,
it was on bullshit. Instagram and I saw it. I was like, that's what it is.
That's bullshit.
It's when you're 50. It's when you go, take somebody's back, but you're the opposite way, and then it's just on there. Right there. It's called balzania.
Well, anyways,
it was kind of gross.
I felt it.
I don't like it. I just get away from that. I'm like, I don't like it. Either way, I don't like it.
It was weird, but at the same time, I liked it. I'm just joking. But
it's okay to.
Oh, great. Yeah. No, no judgment.
Let's just keep whatever interaction there is. Let's just keep it mutual.
Yeah.
That's it. Then everything's cool. And then we go like this. Right?
Yeah, exactly.
Then we're friends. So sometimes things happen. You like that is just as bad to a certain extent as like getting in people's space. You know, like it's like getting too huggy. Jiu-jitsu's some huggy guy on top of you, sweating on you in your face, going.
Yeah.
And you're just like, I don't like this at all. Yeah. And there's nothing you can do about it because the timer's not up. Yeah. And the only thing you can do about it is what?
Well,
there's one thing you can do.
Just
if you just hate it so much. No, if you don't like it so much, you can always
quit.
Right?
Tap.
Thank
Tap.
you.
Oh.
See, he doesn't do jujitsu. He doesn't
Tap.
train
No,
anymore.
not yet.
You just tap. You tap. It's like a pressure. It's a pressure hold, a pressure choke. There's a thing called a smother choke.
If they're gonna, if I'm choking, I'm gonna tap. But
There's
if they're smothering me, I'm
there's
gonna keep
people
trying.
that will put they're so big. I'm just telling you, this is a real thing.
Yeah.
I don't know if you've experienced every possible way you can get submitted.
Oh no,
Because there's not I don't know if it's an endless, exhaustive list, but there may be an infinite list of ways to be submitted. There's a move called mother's milk.
What? What's that?
Can you guess? Cass, I'm
Like
not going to make you guess.
I'm just thinking.
Do you remember Orlando?
Sweat from the titties? From the man titties?
Do you remember how large his breasts were?
Yeah.
And how large of a man he was?
Did he train with Orlando?
Yeah. I rolled with him too.
He did.
Really?
He trained with
Oh.
Orlando.
And guess
That's awesome.
And also, what was that?
Because
What was that short
Yeah.
guy? That short guy.
Donnie.
Donnie.
That
I
guy-
still train with Donnie. He's great.
Can I tell you-
I want to have him on the show.
Can I tell you, this man?
He's the Orlando legacy.
I had no idea who this guy was.
He's
no idea.
Dude, he's a stud.
No idea. And we're rolling around.
He
right?
hangs out with Mario Lopez. He
Saved by the Bell?
he teaches them jujitsu because Mario trains. I roll with Mario.
Yeah,
he's a purple belt.
Yeah.
He's a cool guy, but he's very fit. But Donnie trains him.
But I'll never forget that time I rolled with Donnie. And we were, going around rolling. And then he's like, all right, come on, let's
Donnie
go.
Flowers.
And he was, smaller dude. But
He's very small.
But didn't matter.
Unimposing.
Did not matter. I get on to like, come on. And during this whole time, he's like, come on.
He turns you upside
He's
down.
like, come on, let's go. Keep going. Hey, take my leg. Like
He doesn't let you give up.
I'm trying, and I'm already gassed. I'm trying. He's like, come on.
He would give
Get
up.
my back.
Andrew would give up.
Get my back. And then, come on. And then
He
I hear
made
him say something. He said something like, go for the leg. And then he's like, don't listen to him. He don't know what he's talking about. Don't listen to him.
He's like, don't listen to
He
him.
don't know what he's doing.
He's just a
and
blue
then
belt.
so get my back. I was like, got him back, and I was trying, but my arm couldn't reach over. Then this small guy from the ground stood up, and all he did was this, and I felt like I was like, oh my god, it was. But
He was
granted,
nice to you though. He used to be mean. He was like that, but mean. When I first met him, he was a brown belt.
Yeah.
And it's when I was a brand new white belt. I was literally learning what jujitsu was, and I didn't know that you could go really hard on somebody and it makes them angry, and then they beat you up. So like sometimes purple belts and brown belts will take out their anger on you. And if you're kind of like a guy that doesn't like to give up, they're going to kind of teach you a lesson sometimes in a nice way that you're like, oh, this is jujitsu. Like, this is cool. I really suck.
Hey, but
I really suck so much. Like when you start, how much did you suck?
I suck bad, but
So
I
bad.
loved.
And you thought you might be not that bad.
No,
you always think you're better than you.
No. See, during that time, I knew I just want to survive. Like
Learn survival,
and
because you got to.
But then,
survival.
but granted, I loved it. I loved the move. It's like chess. It felt like, just trying to figure out what each other person doing. I really loved it. I really loved
mic
it.
position.
Oh, thank you.
No, thank you.
I'm not used to things in my mouth.
Get that thing close to you, son.
Oh, okay. I seem like you're used to it.
Tell me about survival.
So
what was day one like at Gracie Baja Lacagada?
Oh my God.
Who'd you first train with? I literally remember the first people I trained with when I first started jiu-jitsu because I didn't know what it was. I just know I wanted to do it. Joe Rogan was like, you should probably learn jiu-jitsu. I was like, I want to learn jiu-jitsu. I want to start podcasting. I'm going to get a Traeger. I'm going to start hunting.
You're going to drink Black Rifle coffee.
No, actually, I don't drink that. Santori whiskey, Toki whiskey.
Yep, that's
the sponsor of the podcast that is unofficially not our sponsor.
Unofficial.
Not brought to you by this whiskey because
not sponsored.
It's not official. I don't want to lie. Everything is true on this show.
But I do remember the first time. I mean, I rolled him later on again, but it was the first
Who'd
time.
You first roll with?
I can't remember his name, man.
Was it Big Pete?
No, he was a young kid.
Wasn't that your cousin? Big Pete?
He was a young
Big
kid.
Pete, the big dude?
No, I don't.
Big purple belt? It was a young
because
dude.
I would go on Saturdays, and then that's where all the purple belts, blue belts, and they'll show me like.
What was it like to roll with Orlando Sanchez?
Oh man, you know what? He was kind. Do you know what I mean? Like I can't explain it. Like he let me try to progress, but I knew he's letting me. But it was in a way that was. He was really. Even though he's a big guy, it felt like he wasn't being really rough with me. He was like kind of coaxing me, and then finally when I was getting close, then he's like, "Oh, here," and just got me. Easily. He took me out so easy. But
how many times did you roll with him?
I think it was like maybe 3 times.
3
when
times.
we're rotating,
He would just come in sometimes.
Yeah,
and if you happen to be there.
Yeah, and
he
then,
was the professor of the gym.
Yes, yeah. And then that's why I would come up to him like I would be like, "Can I?" He's like, "Yeah, come on." And he's
He
intimidating.
didn't care. You're not supposed to ask black belts to roll. You know.
No,
it's like,
but then like just initially, I was like, "Yeah, come on."
he
And
was the best.
He was so kind. He's such a big dude, but he was
beast.
so chill.
He was world champion.
And no, but that's why coming there,
ADCC world.
but
champion.
coming in there, he made it comfortable. Like it was cool.
Beginners to black belts that are like national champions, he would just roll with them and teach you something, or you learn something by kind of watching him and his technique. He was just this giant bear, but he could roll with people that were 120 pounds.
Yeah.
Like he would just move and do cartwheels.
I mean, he could literally just sit on me,
Such
and I'm
an
out.
athlete.
Yeah. Oh, dude, he was so solid.
And then he would just sit on you if you wanted to, and then sweat on you, and then do mother's milk. Do you know what that is?
No, it's
when
his tit was
submit you with it, so you just can't.
Oh, dude, no,
get away,
that
and then
didn't
it just
happen to me.
pressure.
Thank God, thank God that didn't happen.
And then
to
you
me.
die or you tap because of that's really really embarrassing submission. It's called a smother choke. Basically, it's like you can do it in your chest. Do you remember Fight Club? Did you ever see that movie Fight Club?
Of course.
You saw Fight Club?
Never talk about Fight Club.
Do you remember the guy with the big tits in Fight Club? That was because he took too much steroids.
I haven't seen it in a long time.
So he's this big guy. So you should never underestimate big people.
Yeah.
I mean, big people can be very strong, even if they have giant boobs.
Yeah.
And he was a guy, and he had a lot of estrogen, and he had these big boobs. But in the movie, he submitted a guy with submission choke, I believe. That was a smother. And people do that in jiu-jitsu. It's actually a move, and it's really embarrassing because you get stuck in there, and you kind of get stuck in their chest, and you're like, oh my God, what's happening? You're getting smothered, and they just can keep pressing you. And there's so many.
Do they grab the back of your head and just squeeze?
Correct.
Oh,
and it's like a snake where you're just you're just attached to them, and you use your big strong muscles in your legs to wrap around them, and then you grab your shoulders and you just like that in their chest, and it's really embarrassing. And the other thing it can do is break your neck, because the arms can go around the back of the neck, and then either way you start struggling into this tight position. So dude, it's such an interesting sport because it's always like there's so many things that you don't even know right now
of course.
that have already been established that you still have to learn if you want to be an expert at it. And it's rapidly evolving even from right now.
Of course.
There's moves that are happening that haven't even been figured out yet that are still evolving, because then with these new games, we were just watching this new wave jiu-jitsu. We should, I'll put that on actually. This thing on, what was that on, Cass? Well, we watched, Fight UFC,
Pass.
right?
Mm-hmm.
So there was this thing on UFC Fight Pass. We were watching Helena. Actually, I'll just pull up her Instagram. So there's a whole new wave of jiu-jitsu that's coming. So there's a school called New Wave Jiu-Jitsu with John Donaher. Have you ever heard of them?
No.
Do you follow Gordon Ryan?
Ryan, yes. Mike, I can't pronounce the name.
Cass, what's your
Mike,
name? Helena?
what? Do you know his name? Mike, the nerdy kid with glasses.
Oh, jiu-jitsu. Helena Jiu-Jitsu girl. This girl. She just fought at Fight Pass International.
Oh, okay.
The invitational.
Yeah, she submitted this girl. Look at that nasty.
What is her leg?
It was a
Wait a
knee
minute.
slicer. Look at
Oh
this.
my gosh.
Look at this. They had to stop it
Wait a
because she
minute.
was screaming.
Oh my gosh, she from the back.
Look at how many, she posted a bunch of stuff about this. This was ruthless. This happened last night, right?
Wow.
Yeah.
With Maggie, right? Watch.
Oh
how she
my gosh.
And so she started grabbing the back of her neck and then just cranking it towards her. So this is like kind of the opposite of what I was talking about.
It's almost like a Boston crab.
See, look at, she's facing away from her.
Yeah.
Boston crab.
It looks like a half Boston crab,
It was
but
rough, dude.
you know what I'm talking about, right?
Is that like a Stanley Steamer?
No, like
Look at this. Look
wrestling.
at this. Oh, so rough, dude.
Oh wow.
But she's amazing. So she's 18 years old.
Only 18.
She's Helena Jiu-Jitsu.
Oh my God! Look at
I'll
that.
give her a little follow here. There you go.
Wow,
Watch
she
this. This is how
wrapped
she
her
sets it
legs
up.
around.
So she did a leg entry. She then got her into a figure four position, where then she got into a calf slicer. She wrapped around her chest, and then the girl Maggie knew to break her arm right here.
We have a brutal
So
calf
this
slicer
actually
by
really,
Helena
this is a
Krivara.
good breakdown.
We had reached through to the far hip.
She got in. Okay.
See, that's the leg
Yeah,
entry.
yeah.
Manual transmission where you had to drive with
And see, she has her crossed up right here, so she's grabbing her body lock. She lost the body lock, and then she just came up on her neck and just cranked her back.
So-
see, if Maggie goes forward, she's
Yeah.
going to lose the leg lock.
Yeah.
But once she gets a hold of her body and keeps her tight to her, then that's she'll get the calf slicer. Dude, they'll just snap your leg or dislocate your hip.
Yeah.
For the match in UFC for
Yeah, she's awesome.
So you are now a blue belt.
Me?
Yeah.
I'm purple belt.
You're purple belt now.
Yeah. I'll beat anybody up. Once my shoulder's good and strong, I'll choke them.
So now is my time to strike. Is that what you're saying?
You got to get better fast because you have like 3 months to get a little jump start. My
No.
friend Joe Cooper, who's a fan of this podcast, subscribe if you're watching, Joe Cooper, please. And he's also a jiu-jitsu white belt specialist, kind of like yourself, where he kind of trains and then says he does jiu-jitsu and then gives up.
I don't say
says
that.
he does it for longer, but then challenges me and always gets beaten.
First of all,
It's embarrassing.
for the record, I don't.
But
do
he's really he's good for a white belt.
that. Yeah. Okay.
Yeah, and he's really strong. But Joe Cooper, if you're watching, come train and try to get us trained. So what happened to you?
So look. So I was
Come
saying.
train with me, Joe.
So I was saying.
Once I'm strong and healthy again.
When I got sick, every time I would
So you got a little sick. You got
Yeah.
a little COVID.
low COVID
You
and
got
then
checked. You're like, I got a little cough. I
I
gotta go home.
consistently coughed. So
For
I
like
couldn't
more than
like
a week.
Yeah. Oh, it was like a month. I could not. Like during that time. I think my son was. I think he was within the year, still younger. So after that, I got sick. I was like, you know what? And that's when I changed jobs, right? So that's when I realized, you know what?
You changed into pain management?
Yeah, pain management. So I didn't want to. I switched jobs mainly for my son because I want to spend time with him. And when I worked and went to jiu-jitsu, like he's already gone to bed, and I realized, you know what? If I'm gonna do this, I want to commit, because I knew that the first 5 years so formative. I was like, I gotta commit. After 5 years, then I could actually do other things, and I want to do that, right? So, and then at the time I didn't feel good, and I didn't want to go to jiu-jitsu and like cough on everyone. I just didn't want to do that, right? And then that's when I transferred to a new job, and I was like, you know what? I should stop, because I'm able to go home, eat dinner, bath time. Like I had a whole routine, and I want to keep it. So that's my main reason. And it's not because jiu-jitsu I loved. I got to tell my friends, I really loved it. I had so much fun because it was just the camaraderie, but not just that, how hard it was. And it was so hard, but every time I got
the hardest thing in your whole day, right?
And the thing is
to go and just be like, I've done the whole day,
Yeah.
and now I got to go to class where somebody's going to beat me up.
No, but
maybe.
I
most likely, yes.
I loved it.
But also, I'm going to get better from it.
That stress
And learn a
and
lot.
that just that like after, it's just like how I feel about golf.
And I'm joking about getting
Yeah.
beat up,
No.
right? Like you can,
Yeah, I mean,
if you spaz out and
No.
go crazy and try to, it's like then people meet you with that. But once you learn control and like you kind of get banged up at first because your bodies are smacking back and forth, you hit your legs, and plus that gym was pretty slippery. There's a lot of like sweat, and you just kind of like had a lot of bros that were just training hard. And when you're training hard, you tend to get injured a little bit.
I've
more.
never sweat so much in my life.
So much sweat.
I've
It was
never
just-
sweated so
that's
much
where
in my
I came
life.
from too. Is just sweat fest, and it was just like get as uncomfortable as it gets.
But-
so then after that, you're kind of like everything feels way less uncomfortable in my whole life.
Yeah.
Even training now just feels way less uncomfortable than that gym.
Yeah.
It's just like the Thunderdome.
But every time someone submitted me, whatever.
But it was awesome, dude. You
couldn't
learned how to be a
wait.
fighter.
Yeah, I couldn't wait to do it again. But I was so gassed. But that I loved it. I wanted to keep going. But
Absolutely.
But that was my reason.
So great.
But that's why I've gone to golf.
It's cool, man. Tell
Because-
me about golf. So what's that like?
my God.
So when did you really start getting into that?
Do you really want to know the main reason?
How crazy are you
That-
into golf?
No, the main reason why I got into golf. So my wife's
Because you couldn't do jujitsu, and
well, the
and
timing.
your wife let you get out on the weekends.
Well, I don't know how your life
Once
is
a
lived,
week,
but
every
that's
week,
not how I do
dedicated
my life.
time.
But
I do my life. I just do whatever I want,
yeah, sure, got it. Okay,
and it seems to be working out. And then
Ryer,
I have massive
Ryer,
consequences
Ryer.
by when things light on fire. I'm like, oh my god, I need help with this. I gotta, but maybe I didn't make the best decision. So there's pluses and minuses,
Yes,
right, Cass?
Right.
Yeah, yeah.
Right.
Okay.
Let's just say Mike thinks he does whatever he wants.
Yeah. He's not based in reality, guys.
I don't
Does
agree with
everyone
reality.
understand?
That's what my friend said. He's like, I don't agree with reality. I'm like, You live your life that way? He's like, yeah. You know what I'm talking about, Phil?
Yeah.
And I'm like, I'm going to think about that because it sounds interesting. He just doesn't agree with it. I'm like, I think there's some truth to that, but maybe not full truth, but I'm going to keep thinking about that, Phil. He's just this crazy dude. He lives in Cabo. He's a surfer, jiu-jitsu guy. Like,
just living life, huh?
Dude, that's what's so cool about jiu-jitsu is like once you do it and you start understanding what it is and you start talking to people all around the world. I've had people come up to me that talk to me about it.
Yeah.
You know, we just start striking up conversation for one reason or another. And then it's kind of like, hey, you know what I'm talking about. And we connect over that. And then it's kind of like, whatever is next, then that's cool.
Yeah,
of course, wherever you are, it's like you kind of were talking about the same thing.
And it's been at the most random places that we're at, and people just come up to us.
No, but how do they know that he was into
my
it?
ears all fucked up.
His ears.
Oh my God, you got it.
Yeah.
Oh my Mike.
You didn't even see my ears all fucked
No,
up?
I didn't even. Oh wow.
Yeah, so you don't even notice unless you think about it.
No, I didn't even notice it.
Oh,
well, one guy,
I call it fighter's ear.
Yeah.
No.
One guy we were getting coffee. Yeah, and then
It's
one
from
guy we
jiu-jitsu,
were
right?
grabbing
Of course.
coffee, and this
But
guy
you're
just
Asian, so
came up
it's-
to him.
Slippery. Mine's crack. I'm strong. Yours is slippery. It doesn't crack.
Oh my God.
Oh my God.
I wonder how common it is. Like, are there?
It just happens. My brother got it. I get it. And then my
How come
my
some people
coach
don't
had
get it?
Exactly.
Why?
It's collagen. It's some kind of like it's trauma. For sure and you can't avoid
The
it.
constant rubbing on the mat.
No,
on
dude,
the
it
gi.
breaks. It's like your cartilage.
No, but from what? The constant rubbing the mat.
One was really from the gi. When the gi went around and it goes like tension and just it will break its cartilage, you know. And so if it's really hard cartilage, it can crack and then it fractures and it has like a bleeding response.
Did you have to ever drain it out?
And that's with all that.
Did you drain it? Have you drained it?
Man,
Did you drain it from?
No.
She's helped me with a lot of my wounds throughout my whole body. But, you know, it's just you get injuries throughout your whole body.
Yeah.
You know that.
Yeah.
What I just realized is it just toughens it up now.
Right.
And when it gets banged up, it's kind of just like it's more durable.
Yeah.
It's just your body, everywhere get more durable. Yeah. It's all adaptation.
Yeah.
You know, my muscles got stronger. My whole frame changed. My face got different.
Yeah.
You know, you look like a fighter when you start doing that kind of training. If you train, your body responds to it.
Yeah, of course.
And it puts you to this like turned up level, and then you start understanding your nutrition has to be tighter. You need to get calories, you need to get protein, otherwise you start atrophying because you're just burning so many calories and you're sweating so much. You need to be drinking water and you need to be getting your electrolytes, and you got to be taking probably creatine to keep up with all the loss because
you're burning so much.
Dude, you're burning so much, and it's constant and it's great. It's such a great sport, but you only learn it by doing it. It's like, who was the highest profile person I've seen do jiu-jitsu has been Mark Zuckerberg, who I've been like, that nerdy little guy.
I saw
has
that.
probably been like picked on, and then he's been this guy that's just been on his computer and now he's like super successful, and he's realized I have everything in my whole life, but not that type of self-confidence.
No, but
because the only way you learn that is by going out there and doing it. And that guy, look at him now, man. He's a freaking doing MMA.
And
he really is, though. There's no substitute for that. He's even with private training, you're getting banged around. You know, so I respect that he's doing that.
But
and
also,
cool.
it seems like he likes it because the way he thinks,
it helps him.
No, but it's also because jiu-jitsu is very technical. You know, it's like I said, it's like playing chess.
You know, however you want to make it.
Yeah, and so that's why it makes sense why he would want to do it, because it's very
he locks into it. It seems
analytical. Like, I'm sure he's just all in.
Yeah,
you know,
it's worth his time. It seems he carves it out of his day.
Yeah, of course.
You know, pretty much to train. It was interesting listening to him on Rogan's podcast. Did you listen to both the newest one?
I listened to some of it. It just.
He was kind of like, "Hey guys, I'm on your side now."
He's kind of weird. It's just a little weird.
Well, you know what I mean, you can tell it's all proctored, or like it's all he knows how it's gonna look on that whole. So he's like, "I'm gonna look like
on the
this
big stage."
guy. Exactly.
He just wants to be like, "I'm like you guys."
Exactly. You could see it's compare it. Why'd you put the first episode up before the election and then now after the election? It's like, what's going on here?
Yeah, it's a little weird. It's really weird.
It's weird, right? Hey, why are all the tech guys up with the president in the same room?
Yeah.
Oh, when all these people were literally fighting Trump as hard as they possibly could, saying he's the worst person ever.
It doesn't make sense.
Well, it does make sense because guess what they care about?
Yeah.
Money and power.
Yeah,
and
of
they're the
course.
ones with it.
Yeah.
And they're the ones that are paying all the special. That's what special interests are.
Yeah.
They have special interests.
Yeah. Oh, is that what that means?
Their special interests,
Oh, wow.
they donate to the campaign.
Oh, what?
Yeah.
I can't believe that.
Yeah, let's make
That's
these,
real?
Let's put these kind of bills in the bills and then put the little.
Is that a
in the 400 page
conspiracy theory? Is that what that is?
It's just what happens, man. Conspiracy must involve 4 or more people. I think there's a rule to conspiracy.
I'd rather call it truth seeking.
So did you ever get injured training? Actual injury, like something torn?
No, I mean, I tweaked my neck a couple times.
I thought you were neck, right?
Yeah,
I thought
neck.
that's why you stopped that.
No, but I told you, the real reason because time for my son.
Right. But
that tweak on my neck.
How was the neck?
That was fine.
Was it muscle spasm or something?
No, it was just tweaked out. But I loved it. Like I said, I really loved it.
Is that why you got into pain management?
No.
So,
yeah. I went to pain management because I'm sorry.
Is that why?
No, I went to pain management because I wanted time with my kid. That's the only reason.
Oh, so changing work schedule kind of thing too.
When I was like, when that happened, I remember it was December. I was still jiu-jitsu and I stopped, got sick. December, got offered another job in another area. And then I was like, oh, wow, this is a perfect time. No call, no weekends, no holidays, 4 days a week. I get to spend as much time with him. I get days off. It's great.
So tell me about pain management. What has that been like? What's your role with that, and how is that different than the OR?
Completely different.
Because you work as a nurse there, right?
It's completely different.
What's it like doing it? You assist with procedures, right?
Procedures with injections.
So what is pain management? What are pain management injections? What do they provide for people?
So they provide relief to pain from either surgery or they have issues with their back, hip, knee, shoulder, and I guess sometimes they do this before surgery or not, alternative to surgery, and sometimes they do it post surgery. It's just pain management, and then our clinic doesn't really focus on giving opioids to patients, so they offer procedures. Of course, they still do give pain meds, obviously, but it's not about that. It's all about the procedures,
What percentage are roughly, just what you can tell based on in terms of what your involvement is, like what is your percentage involved in procedures versus their involvement with medical management for pain?
Man, for me,
for what you do.
For me, it's
is it all procedures?
Yeah, I'm mainly because of my background, so they always put me in there, which is completely fine. I love it. I do clinic there. So the basic area. Yes,
you do.
So I kind of do. Anyways, I do.
You do in clinic? That's
so
gross.
there's different areas. Like
so you don't like going to clinic, huh? Because you do in there.
A little bit. I mean, I have to talk to people.
OR is better.
I'm not really good at talking.
You don't
to
have
patients.
to.
I don't
Just go to
wanna-
the OR. Just do procedures.
I know.
Do you get to do stuff? Do they let you do anything?
No, of course not.
Do you get to operate?
No, of course
They let
not.
you do the shots, right?
No.
They let you just hold it and say,
Never.
Never. Just hold here, Andrew.
Well, I don't trust
Now
myself.
slowly insert it.
I don't trust. I wouldn't do it myself.
No,
That's-
sir. No.
Remember?
No.
The bar low.
Yeah, liability, sir. No. That doesn't
But
happen.
so our unit is that there's a pre-op, procedure room,
Of course not.
recovery,
Right.
clinic, another clinic, and triage.
Mm-hmm.
That's the whole vicinity. Like there's a whole unit, and we all rotate over.
So let's say, when you used to work with me, describe some of your roles in the OR with an orthopedic surgeon like myself, and what you used to do with me, and then how is that different than what you do now?
Completely different.
Well,
Because
but what kind of things do you
so
do?
the difference is
So
in
like,
the
what,
O-
say a day in the OR with me.
so
What would you do?
So the OR in your room, first of all, it's sterile.
So you're
Okay.
checking the music,
The music, supplies,
making sure the reps are there.
the reps
so
are
you're kind of
there,
managing the room,
checking out the
really.
nurses, all that kind of stuff. But
Checking on the nurses.
sorry, I misspoke.
Checking
I
on the
apologize.
patients.
I'm just
so
joking.
let's say you meet the patient, you bring him back, you check everything, you talk to the anesthesia, you talk to the surgeon,
Yeah.
you go to the room, and then surgeon's doing the case. Then what are you doing besides shopping?
Besides shopping, make sure the script tech's good.
So you'll go.
messing around
So
with
what
them.
if he's not good?
Well, then I have to go out, get
You have
stuff
to
for
open
you.
stuff.
Yeah, I have
right?
to open stuff
It's mostly
for you.
opening things,
During
the
getting
case.
things ready, and when it's winding down, I like usually. So this is how it is. The beginning of the surgery is kind of like, all right, we gotta do all this stuff. During the surgery, it's kind of like, all right, I'm just gonna give stuff to the surgical tech what they need,
handing things off,
certain
right?
things, and the end is the wrapping up. So usually the in between is there's a little bit of downtime depending on how fast these cases are. If they're longer, then you have a lot of time to shop online, listen to music, whatever. But I'm just joking, by the way, please.
So like, here's the setup. This is
the
what,
front and back, the first part and the end part is usually the part that's like you're running around kind of.
So this is what a OR table setup looks like, right? These are all my instruments for the
No,
shoulder.
that's not. Don't lie. That is not.
It's perfect.
It's not.
It's beautiful.
Oh my god. Let me see. Can I see it? Let me see it again.
Right there. It is all my instruments.
No, you don't use all of that at once.
No, for a total shoulder. So this is all my special instruments.
You use
for a
all
total
those
shoulder.
home ins. No.
Not all at once, but those are all my instruments in my tray.
Because I'm telling you, a surgeon tech will not put all that on the nail stand.
No, because they shouldn't. They should put about half of it. Because at a time you got to.
Okay, I was about to say that's not.
No. I said setup. I didn't. I shouldn't have said setup.
You misspoke. What's wrong with your English?
My English, no, is so good.
Your English, no good.
Sorry, man. Hey, but if you're here, it's okay. So I thought I had a video about.
Wait. Before that, let me ask you a question, okay?
What?
Because I'm very curious about this. Okay, so. There's been patients that need, let's say, injection in their shoulder, right? Post-op of like a total shoulder.
I can't find it. I'll find it. Yeah.
So my question is,
did you say post-op injection?
Yeah, like post-op. Let's say for sure. I'm just giving an example. Usually, I'm mainly for a knee, but a total knee. But let's say I'm trying to say for you for a shoulder, right? Okay. You're doing a total shoulder.
Okay.
You're all done.
Shoulder replacement.
Total shoulder replacement.
Got it.
They come to the pain center. Mm-hmm. They have pain. Mm-hmm. We inject, right, in the shoulder.
Mm-hmm.
So my question is, I wonder now, do people get injections like post-op knee, total knee, post-op fusions in the back?
It's a good question.
Why is it? I feel like, is it how they expose the tissues? Are they damaging the nerves? Are they is there a better way? Because I've seen it. Like, why are people coming in after they have total knee? Because they're there for pain. So why are they coming in for a genicular nerve block?
I think that's an excellent question. And there's a few reasons for that. And I think that it is a general question, but with specific answers and on specific cases.
Let's say for shoulder. Well, you for a shoulder.
Right.
Let's pretend like, oh man, my shoulder still hurts after that total.
Mm-hmm.
Why are they coming in for a shoulder injection?
Well, I'm going to answer you conceptually first, and then I think there's going to be anatomic reasons for that.
Yeah.
And the conceptual reasons really, and I'm going to clarify your question.
Yeah.
And your question, I think, is joint replacement surgery has been performed.
Yeah.
There's been a total joint, meaning a total shoulder replacement, either reverse or an anatomic replacement with a ball and socket, the hip replacement. Not seeing a lot of hip replacement pain, right? But knee, yes. Yeah. So let's say knee and shoulder. And knee replacement is a total knee replacement.
Yeah,
so they've opened it up, they've taken out the cartilage and the bone that's degenerative, and they put in metal and plastic and cemented in or non-cemented, either way. But there can be reasons why there's expected improvement in pain, and there can be reasons why there is not improvement in pain.
Yeah.
So number one would be inadequate resection of the pain receptors that are causing pain. Okay, so that's one.
Mm-hmm.
So for example, in the shoulder, there's nociceptors and there are mechanoreceptors that will go light up, and those type of receptors in certain areas like the biceps groove and the subacromial space and the joint capsule, they all have these receptors on the ends of them that get connected to those nerves, and those nerves will then send signals to the brain saying, hey, there's a problem here. So after you do surgery, they're recovering, and it takes a long time for that to recover, so it should take a while. So really, after you do that type of resection, the nerves should respond after a certain amount of time. So you're saying they're not getting better. It's been long enough. They should have recovered. Was there a problem that wasn't established at the time of surgery? Maybe that patient has always had pain in those areas, even after surgery, hasn't gotten better. So it really depends on their history and their history before and after surgery, and what their pain was like before surgery, and what the diagnosis was, what the reason was that they had surgery. Because a lot of times, if something is correct, that say that the arthroplasty is done appropriately and everything's aligned right, you don't even know if they've denervated those areas, if you've done all these releases that kind of may clear out those nerve endings, those receptors, and kind of like disconnect the pain receptors in the actual area from the nerve receptors that go to the brain. Yeah. So there's certain steps of surgery that I'll do that I think are related to pain, but I tell people I cannot see pain. I don't know what it looks like. Yeah. No, but I just know how certain things are associated with pain. And when I do those things, it seems to remove pain. And so I keep doing them. Yeah. So there's certain ways that I do surgery that I'll do it the same way. And Rick Cash from USC taught me remove all pain generators. There's a thing called rampage. It's like when we get in there, rampage, like just if there's a possible thing that may cause pain, like the biceps groove, subacromial space, decompression, bone spurs, remove all that, impingement, remove all that. And then the capsule. So if that gets inflamed or tight, you want to release it, get everything moving normally so it can heal. So I think we're removing pain in that regard. And so when you say, why would they continue to have pain? The second reason could be it's a wrong diagnosis. It could be that they have pain in their knee because they did have arthritis, but they also have a low back issue and they have a herniated disc, and it's putting pressure on the nerve that then innervates the inferior branch, the inferior genicular branch to the medial patellar branch of the saphenous nerve, right? And then it's causing knee pain. Oh my God, it hurts in the front of my knee, right on the inside. What does your back look like? Well, there's a lot of degeneration. Well, it's probably some compression. But did it get better with your injection? Did it get better with therapy when you treated those things? And if the answer is yes, even to some degree, then it's probably a misdiagnosis. Or there's additional diagnosis. People say like, oh, they did the surgery and it didn't make me better. Well, did it make you any better? Well, then, it made one problem better, but you had two problems. So let's try, now we got to fix the other problem.
Because I was just wondering about that because when I saw,
those are the two main kind of categories.
Because when I saw the genicular pain for total knee, I just saw people coming in and I was like, is it, because I remember in surgery, like you see,
could also be a neuroma. People spend a lot of time on their knees. That's why diagnosis is so important.
Because I was wondering, like,
what's causing the issue.
Could it also be because of technique of how you expose everything? Like, could you be retracting too hard? Could you be doing certain things? Because I mean, the knees look beautiful, right? Well, after, but why are they doing these genicular?
There's a certain. I'm not an expert at this, but there's a certain amount of people that have pain after joint arthroplasty, total knees especially, and total hips. There seems to be less people that have pain.
I've not seen.
And after total shoulders, it seems to be related in some way to technique and to soft tissue handling and to diagnosis.
Because that's what I was kind of thinking, like, why?
Because I seem to be seeing people with a lot less pain that move better and are less stiff. Have the same complication profile. Where you're not seeing any increase of complications, but better outcomes. That's what I'm going for. Is like try to keep the complication profile the same. There's always going to be something that happens. But you try to minimize any risk, so you keep doing the stuff that tries to help, like totally sterile technique, doubling up on scrub brushes and whatever seems to be a way that you can just totally cover whatever you think might be an issue. Double gown and gloves and drapes and this and that. And those things do show sterile technique matters. And we don't really know where the bacteria are. We just have to assume things are sterile. And that's why surgeons are crazy people.
They're crazy.
They're anal, super anal, right?
I don't know what I'm talking about. I just want to make clear.
But you work with a lot
I'm
of
just
us.
making, it's my opinion. Just please, I don't know what I'm talking about. Okay.
Just talking here, folks, for entertainment.
Just talking. Yeah, I'm drinking. I need another drink, actually.
Which one do you want? You want to hit this?
Let me get some ice. No, let's do it neat. I'm okay with that.
Do you want to pause here and we'll get some ice and stuff, or
no, let's go. I'm cool.
Going?
Yeah, let's go. Let's go neat.
So, what's it like to work with surgeons? And so, do you like? So you bailed from the OR so you could work with pain management,
no, but
not surgeons, right?
No. I bailed.
Do you want this one?
Yeah, sure. I bailed because of family. I love the people. If I could still be there, I work with you all day.
You're always using that as an excuse.
No, it's not excuse. See, you say it's not.
I mean,
excuse.
It's a good excuse.
It's reality.
Family.
No, it's reality. I have a second lease on life. I'm not wasting it. I'm not gonna do that.
Cheers, friend.
So thank you. But good. It's the people.
I've hit this mic 3 times. And we're back.
Yeah.
After a brief break, folks, we're back.
A real quick question before we start.
We have
Cass, how was your jiu-jitsu experience? Because I know you were rolling. How was that?
It was awesome. Until I had to stop. But I was like you, like it was such a hard thing to do, but so satisfying.
Yes, right.
When you were done training, and then it was like so hard to get there. Like it was just like, oh, like I don't want to go to train today. But then once you were there, once you did the class, and like once it was done, it was like, oh my God, I would tell Mike, like it's
You're
so
glad you did it.
satisfying.
Yeah.
It's just like you don't even like, you put your body through like this. I can't even explain it. It's weird. We would talk about it and I'd be like, I don't know how to explain it, but it's just like this really hard thing that you think you can't do, and then you go, and then it's like, oh shit, like I did this. And then like every day it's just like a different thing and you get better. Yeah. I feel like I got like not really good, because obviously like I'm still a white belt.
Of course.
Where my training ended, when I stopped training, it was like I had learned so much, and
it built confidence too, right?
It built so much confidence in me.
Cass, you competed after like 3
I can't believe
3
you did that.
months of
that's
as a white
insane.
belt.
That's it was
insane.
so
you
scary.
Fought those badass girls from Northridge, right?
Yeah.
Did you win?
I
They
got
were
third
almost blue
place, but
No,
You got 3rd place.
Still,
That was impressive.
no, but also to compete around other people, that is another. That's another level for sure to compete. I mean, you competing too. I remember seeing you. It's amazing.
I like to put it this way. When you train, you could be 10% to 90% usually. Hopefully it's not 100% effort and intensity.
Yeah.
When you go to a competition, it's always at least 90%.
Wow.
At least you're starting at 90%.
I'll admit to you right now.
It's so intense.
It'll like it's a head game, right?
Because somebody
It'll
else
fuck my
is
head up.
out there and they're trying to beat you.
Yeah, of course.
It's interesting.
And they're from a totally different dojo.
You have
they're
no
trying
idea
to kill
who
you.
they are.
They
might be a psychopath.
Yeah, yeah.
Hopefully they're nice.
But how many have you won?
But there's a ref there. And,
no, but how many have you won so far?
Oh, gold?
Yeah.
2 or 3, yeah. 2 gold, I think.
Listen,
and silver. I've done okay, but
that's
it's
impressive.
just, it's
that's
amateur
impressive.
stuff.
No,
It's amateur stuff.
but still, that's impressive. To compete in
To compete at all is intense.
and in front of other people.
A lot of injuries from competition
So before jiu-jitsu,
and training.
I did taekwondo or whatever, and I went to
You did taekwondo
Yeah, of course, as a kid.
in Korea?
No, I was born and raised here, asshole. I did not. I was
Calabasas?
and I wasn't born in North Korea too. By the way, I just want to
South
clarify
Korea,
South
of
Korea.
course. No, we don't
but I was
talk-
born
you
and
can't
raised
talk
here.
about North Korea.
Yeah. But I
Not on this
did
podcast.
taekwondo for so many years till purple, because the dojo I went to was very.
How many years?
To get to purple belt 3 stripes took 5 years, 4 years. Took this place I went to, this taekwondo place my parents knew. This guy was Olympic judo guy and taekwondo guy. So to get a black belt, it wasn't
Judo and taekwondo.
Yeah, it
So
was.
He was a real.
It wasn't
fighter.
and some places they just could give you belts. No, every belt had you gotta go
He
3
probably knew
stripes,
how to use
2 stripes.
swords too.
No swords. Racist. But
Hey man, swords. If the zombies come,
Yeah. Oh.
swords win. It's
I'm in.
The crossbow and swords,
Hey,
like samurai
if
swords.
zombies came, I would not hesitate. If
Because the
someone's drilling,
guns, the bullets run out, man.
Yeah. No, you're right, yeah.
There's the zombies. Are
unfortunately, you
unlimited.
can't choke them out. you gotta
Jiu-jitsu does not work against
No.
zombies. Arm bars.
No,
Arm
doesn't.
bars will only buy you so much time.
Exactly. They're gonna bite
And
you.
you might get bit if you're too close.
But I'm glad you're talking about zombies, because I'll tell you, I will not hesitate. If someone's drooling, walking me, fuck you.
So what's your plan if it happens?
Oh,
You know, you
man.
have let's just put it this way. We haven't ever had this conversation, but I know now you have a plan.
Yes, because you have a plan. Because I know you have a plan.
Of course I have a plan.
I have a plan too. Oh man,
Cass, you know
I
the plan.
already told some of my fam, right?
Cass
I was
has a
like,
plan.
if shit hits the fan,
Exactly.
I told everyone, come to the house. We're gonna lock down. That's the first thing.
You say
My-
lockdown?
My brother-in-law.
Is that your code word?
My brother-in-law, other family was like, "Yo,
People think
just
you're
come to
crazy
my
just
house."
for saying
No,
that. It's so
no.
important to have
But
a
they know.
lockdown plan.
No, they know if shit happens. I told them, come to the house.
Happened to me the other day.
What?
Oh yeah.
What do you mean?
There's people out there that just,
Oh,
have ideas in their heads.
That's
C
right.
knows.
That's right, dude. I was really worried for
Yeah.
my wife, and
Yeah.
then
Well-
I thought for you too. I was like that.
Sometimes there's just threats out there, So
Yeah.
just you got to
That's
take
right.
threats seriously. That's all it is.
Yeah.
And we don't got to talk about details,
Yeah.
but there, when there's threats and there's real threats,
Yeah.
And turned out it was.
It was a real threat. Yeah. Yes.
You know, take all threats
Yeah.
seriously.
Yeah.
And that's what jujitsu is, threats. You know, it's like you're learning from people that are threats because they're trying to get better at jujitsu. And that's the only threat.
Yeah.
And if somebody's really trying to hurt you,
Yeah.
you don't train with that person.
No,
right? That's no way that's happening.
So it's like,
you know, it should be about learning. And if you want to come to classes, you just email them and say, hey, can I come in? Or just stop by and say, hey, can I come train or watch the class? And
did
come try it?
you take anything before jiu-jitsu? Did you take kickboxing?
Never.
Nothing. That was the first
had a few
self-defense.
interactions that I was like, whoa, I don't like physical confrontations, but I played football, so I knew about physical confrontation and that there's giant people out there that are freaking strong.
Yeah.
And you'll never be stronger than some people,
no
matter how strong you are. And so I knew my strength was only going to last so long and be so strong.
Of course, yeah.
And so I just knew there was a deficiency because I didn't know how to fight. And I knew when COVID happened, people started getting a little crazy and kind of like talking about like, where are the guns and stuff? And I was like, yeah, where are the guns? Where are my guns? And like, do I know how to protect my family?
Now,
and then I realized I didn't. And so after COVID kind of ended, then I actually trained through all of that.
No, now with
I learned through a
jiu-jitsu,
lot of that.
now that you're progressing, now would you
Because the
also
zombies
add?
come, you gotta know how to fight.
No,
You
but
gotta
would
know
you
where the guns are.
No, but would you add
What's
to
the
that?
plan? Lockdown, Cass.
No, but would you add to that?
Add to
like
what?
Like kickboxing, Muay Thai. Would you add to your arsenal? You know what I mean?
I'd always add to the arsenal.
No, but did you?
If you have a safe, you just get another safe.
No, but did
if
you?
you have 2 gun safes, you get 3 gun
So
safes.
when are you gonna do Muay Thai? Are you gonna? Oh,
when I come back, my shoulder's working. I'm gonna do MMA. I'm a full MMA.
Okay.
And if my head gets too banged up, then I'll stop.
So like I'm
doing kickboxing when I come
that's
back. Maybe
definitely
Muay Thai.
important. Yeah, because like I did
but I have
taekwondo.
my bag out in the garage to just train as much as I can.
So I did taekwondo, and then
So
from
tell
there.
me about that.
So I did taekwondo.
How old were you when you started that?
God, I don't remember.
I did a year of taekwondo.
I did it for a long time. Like
I didn't
think
learn
it was 4
anything.
years. I learned a lot. I think it helped
Did
with
you spar?
my hip rotation.
What
You
is
know-
sparring like in taekwondo?
Well, hip rotation. Like I think taekwondo is all about but not just hip rotation because it gives you the strength to punch and kick.
You learn how your body.
Yeah,
moves.
I know how to rotate my hips really well.
So did you ever do competition
No, I did little competitions at the park. Within
with
the
little people?
Yeah, no, when I was a kid, like within the group and other dojos.
Yeah. Like within
Within
other
dojo,
local places.
Yeah, local
Gotcha.
places.
How
And then-
old were you?
Man, I don't know. I feel like I
Like
came out with
14,
chopsticks and
a
a
kid?
kicking. I don't know. It was
You were a little kid.
no. I mean, I think it was
Last
like
year?
little kid before 10 and after
You were beating
10.
up little kids last year.
Before 10, after 10, I still beat up little kids with the left punch. But
So when were you done with taekwondo?
I think I was like 14, maybe.
So
And then from there, school. But then I got in fights and everything else.
you
But
got in
then-
fights?
Yeah, I got in fight. Yeah.
When was your first fight? Actual fight. How old were you?
Real fight.
Real fight. What was that like?
I mean, other scuffles, but
What
the
happened?
real fight.
Tell me about it.
I don't know. I don't want to talk about it. But 16. 16 was a
So
big
you had already done taekwondo,
taekwondo.
and you felt like you knew how to handle yourself.
Yeah, and
And so you decided to.
well, no, it was
beat somebody up.
So
or defend
okay,
somebody's
I'll give
honor?
you the short version. Okay, so it was 4 of us.
Don't ever try to fight people.
No, listen, but this
Folks.
is but
Not you. You know.
no, I know, and it wasn't.
Don't
and
fight.
I
Go the
didn't
other
do
way.
that.
Don't
we
fight.
we were pushed to this. So I think it was me and it was 4 of us. We
How old are you?
16, 17. 16, 17. So
You don't know. Your brain's not working.
yeah.
Doesn't work right.
But listen, this is crazy. It was 4 of us. We went to go eat at my friend's restaurant. 3 Hispanic guys were outside. We walked by. And
Let's not bring race.
no.
into
So
this.
we're walking in. We're gonna eat. We look like we just came
But
from basketball, right?
They were Mexican dudes.
They were Mexican guys. And 3 guys, and we walked in, and they're like, these effing chinks. So I was like, oh. And then while we're walking, I was like, hey, if you're still outside, I'm gonna beat your ass. So we went inside, ate dinner, and while we're eating, we're just joking, talking like, okay, you take that guy, just joking, not really, no, it's not him. But they called us that, so we're eating, and after we're nonchalant, we went outside, and they called us chinks again. So we're like, I was like, oh, really? Come on, come over here.
So it's your own honor. You're trying
No,
to.
we're like, come on, follow me around the corner because we don't want to fight in front of his mom's restaurant. I'm like, come on. Anyways, long story short, got in a big fight. We beat them up pretty bad, really bad. Cops came, ambulance came, friend got arrested.
So you're beating them up bad enough that the cops
it was bad.
came.
It was bad. At the time, I didn't know these two guys were throwing up. It's because they had concussions. You know what I mean? I didn't know that. Now I know, but we did because they asked for it. We didn't look for it. I didn't try to. But
some people want to go out and pick a fight.
yeah, that's what they did. Exactly, because they looked at us like, oh, these Asian kids, they don't know.
They're
anything.
probably in a gang, and they said, "You guys got to go fight somebody."
Yeah,
and they saw
then,
some Asian guys and like,
yeah.
"Hey," and started
Yeah.
messing around.
And that's
sometimes you learn the hard way.
Yeah.
You shouldn't mess with people that know how to fight. And guess how you know how to find out who knows how to fight?
Yeah.
Either you train with them,
Yeah.
or you get beat up because
Yeah.
you shouldn't mess with people.
And that was
don't mess with anybody.
I guess that was one of the biggest. I got punched in the face,
yeah,
but
it sucks.
Like punch in the face
Sucks
it
a lot.
didn't even faze me. I turned around and kicked the guy in the
Your
ribs.
adrenaline's going crazy.
But then I have sensitive skin, I guess.
But
It
people
looked-
who
it
know
looked
how to
like I
fight,
was-
they do that all the time.
Yeah.
They're always fighting people. They're
Yeah.
always getting kicked in the head.
Yeah.
And then they know how to strangle you, so they're not getting kicked in the head.
But I think
so
the
it's like people who are trained fighters will win in a
Yeah.
street fight, obviously.
But you
unless
need to-
there's like
But you need to get punched.
yeah,
Like once you get punched, have you been punched in the face?
yeah, it sucks.
Okay, so when you get punched in the face, then you know how it is. So me knowing how that is, I'm already prepared for it. Like if no one's ever been punched in the face, they have no idea that feeling that, you know what I mean? Like
At some point in your life, you get punched in the face.
I hope. So I think everyone should get punched in the
Everybody
face.
does.
They need to get punched
Sometimes
in
it
the face.
happens early.
Yeah,
Sometimes it happens
mine
a
was
lot
early.
later.
Early. I'm glad it wasn't
But
later.
it happens at
but
some point.
Yeah, you need to get punched in the face.
Everybody does.
You know, struggle builds character.
Yeah. But you should not fight.
No, and I don't
But
condone
if
it.
you
I
just
would.
one thing I learned with my boys too is because I learned it now so late with jiu-jitsu is like you're just helpless when you think you know how to fight when
Yeah.
you really don't.
No,
Because
you need to
trained
learn.
fighters, which is what I am,
Yeah.
you know, and people who know Muay Thai and Taekwondo to a certain extent,
Yeah.
right? You have to have I don't know how many years.
Yeah.
It takes long. Like with jiu-jitsu, it's so effective
Yeah.
that you can use your body and learn it to be effective in how long? 6 months, maybe? Like to be pretty effective. 3 months even to be better than you were before.
Yeah.
But I feel like punching, kicking, sometimes if you move wrong or you're not in shape,
Yeah.
you might train a little bit and you think you know how to throw a punch.
Yeah.
You may not really
Yeah.
be able to fight somebody.
Well, I'll tell
But
you now.
think you know how to
I'll
fight
tell you now.
somebody.
If I got to fight right now,
yeah. You would be fine.
no,
I know you'd be fine. But you probably will get hurt.
But I'll get hurt. But granted,
You're gonna get
I would
hurt.
never like right now. In my part of my life,
it starts with street and ends with fight. That sounds bad.
See, right now, my life, I have too much to live for. Right? If someone's like, "Hey, you,"
So
chink,
the rule is you go
chink
the
bitch.
other way.
Yeah, chink bitch. I'm like, "Thanks, guy. See you later." But
That sounds nice.
But when
Thank
you're-
you, sir.
Yeah, but when
sounds like you're having a bad day.
But
You
when-
know what?
But when you're
And-
younger,
That's the right
when you-
thing.
But when
Don't
you're
fight.
younger,
There's always a better answer.
yeah, when you're younger, you don't have that vibe.
And the thing when you start training jiu-jitsu and stuff, it's like, look, I'm not gonna sock you. I'm probably gonna put you to sleep.
Yeah.
So just let's not fight.
Yeah.
You know, it's like you learn more. Like for me, it's like, okay, I know how to choke someone now.
Yeah.
So it's like I'm not gonna
Yeah.
sock you in the face
Yeah.
and then have you like sock me back. Like
Exactly.
I'm gonna put you to sleep
Yeah.
because I know now how to do that. So it's like, don't mess with me.
Yeah.
And it's like the other thing about jiu-jitsu, it's like it doesn't matter how big or how small you are.
Yeah.
If you know the technique, you can take down someone that's like bigger than
I
you.
witnessed that firsthand. 100%.
Yeah.
No, but that's why the fact that you know and you walk away, that's more important. I think that's
For sure.
because it's not worth it.
Cass, were you ever in a fight, like a street fight?
When I was like in middle school.
But
All you
after
youngins
that,
getting
never. Right?
fights.
No. Probably maybe when I was like 22, like at a club. It was like my friends were fighting and then it's like, okay, you're gonna
Your
jump
friends
in.
were fighting.
Like this, yeah, like my
Sounds
two,
kind of
yeah.
ratchet. I'm just saying.
Very ratchet.
Down
Very
at a club,
ratchet.
huh?
Okay.
Why weren't you guys just having a good time?
You know what?
All a
Just
bunch of pretty
girls.
girls.
Yeah, it's like,
Getting-
oh god, look at this bitch's
they can
shoes.
they can fight and they're beautiful.
or they're just hating. Like,
Or
oh,
you just
look what
yeah.
this bitch is wearing.
What was it over? What started the fight?
It wasn't with me. I think it was with one of
Oh,
my
of course.
friends, and I have no idea. I just know that like I turn around and they're fighting, and then the friends were getting
Like
in.
physically punching,
Yeah, like
pulling hair.
pulling
It's
hair,
probably-
pulling
It
hair.
starts with that, right?
Yeah.
Pulling hair, and then it's
100%.
like
Grabbing
you're
whatever you
just trying to
can.
get the friends away
Yeah.
from or off the friends. Yeah, it was so
Which
dumb.
friends are mine? Which the blondes and the brunettes and the
You just turn around and there's like hair on the
Yeah.
floor. It's like
Hey, Mike,
somebody lost
do
their
you,
hair.
So when I would roll on the weekends,
Lost her
I remember this guy. I don't know why he stuck in my head. His name was Bob. He was a purple belt.
Oh yeah, old
Older
Bob.
guy.
Yeah, he got in a fight.
Can I tell you,
Yeah.
that guy was such a great guy. He showed me moves, and after he did it, like, all right, let's roll. It's like, I'm not gonna be like, I'm gonna go hard on you right now.
Yeah.
I showed you this, but let's go.
Yeah,
He destroyed. But before that, he was showing me.
he had old man strength.
Oh God!
Yeah.
But he was showing me how to do this.
He had like the
And
purple belt that was like barely tied. You know, it was like so wide. It had like the little tie.
Yeah.
You know, but, it was a big belly.
But such a nice dude. And
Super cool.
I
learned from all the old dude purple belts. That's where I learned so much.
And then
from the start.
I remember a Korean guy on Saturdays. I don't know. I feel like his name was
yeah.
Ray, but
Yeah,
he was
yeah,
a Korean, stocky Korean guy, big guy.
Yeah.
And you know what he teach me? Like I was like, hey, can you show me? He showed me. And then
you guys bonded because you're both Asian.
probably he's Korean too. He put his knee on my chest. He's
Oh, Korean.
And
Yeah.
then he's like this. Yeah, he's like, you feel that? Don't struggle. Like, calm down. Like, I know you're.
Feel
I was
it,
like,
right? Feel it.
I was like, oh, he's like, no, hey,
Yeah, just be calm.
calm down. And then just the way he showed me that.
Yeah,
It was
they would
very
teach you like concepts.
yeah,
right?
but they could kill me, right? It's
Totally.
easy. But then they were cool about it. And then when I rolled them, they were like different people, right? Like, you know, like,
Then they show
yeah,
you.
they'll show me.
Because they're working on
yeah,
stuff.
yeah,
They'll beat you up.
exactly. Like, but that's what I love about jiu-jitsu. Just that one guy with that guy was. I remember I told you about that. And you're like, well, and you said this to me. I remember like you said something that you told him, like, what the, like you got mad at some guy, and Orlando was like, just get out of it.
Exactly.
What are you doing? Just
Whatever
get out of
it
it.
is, just
And then
figure it
I
out.
told him about that situation about that white belt doing this, and I just like was so
is he allowed
mad.
to do that? Can he do
Yeah,
that?
yeah,
Is he
yeah.
allowed
And
to,
then
like, if he's not punching you,
Yeah.
or like gouging
Yeah.
your eyes out, Orlando would teach us that. I'm like, then you can do it. It's like, just don't let him do
God,
it.
it was
just figure
but,
it out.
But that annoyed me. And then
It
I
means-
then I
it
tell
means he's-
him.
It means he would tell us. It means he's opening something else up, because that's something weird. Like, oh, is there a submission from that? Is that something that's known?
No,
that's
but
gonna like,
but
yeah, no,
it's
sucks,
a dirty move.
but
Like, why would you?
It is
We're white
dirty.
belt. Why would you rub
But
your
his-
gi on me?
his-
Like that's.
But Orlando's point is, if somebody's doing something weird like that, then they're putting themselves off balance, and maybe you can sweep them. You know, and then maybe because they're putting so much pressure in this weird move that doesn't make sense, there's an opening for something else, and you can beat them easier that way because they're silly.
Yeah.
You know, if we're doing something like
It
that.
was like this one
don't
guy
be mean.
at
Yeah.
when I was training. It was like he was a higher belt, some older guy.
Yeah.
He like slapped me.
he slapped you.
What? Wait, no, don't
we
lie.
were drilling,
"You
and
like
he
that?"
like no,
No,
he
what?
went and he's like, okay, so if I'm doing this, what are you gonna do? And then I'm like trying to,
Yeah.
like grab his
While
legs
he's
and stuff.
rubbing on you.
No. And then he ends up like going like that to me, and I'm like,
It was like
With his
self-defense
what?
class.
With his
Yeah.
hand.
He was trying to teach self-defense
So-
while they
No,
were training
no,
or something.
no.
yeah. And so I'm like,
don't-
okay. And then we
Sir,
went on
please
live.
don't
We
teach
went like live, right? And so I ended up taking his back, and I was gonna like
Yeah.
submit him, and
He's like,
oh, stop, no, my back. And it's like, you just
gives up.
slapped
He's like,
me.
"Oh."
It's like, you slapped
What
me.
belt was he?
He's
He was now he's a purple
advanced.
belt.
He's advanced.
Sounds,
Advanced age.
But it was like a very
sound
older
right.
guy.
Look, why would he slap him?
Everybody figures the whole thing out differently, and that's what's so interesting.
That's
it's
weird,
like you
dude.
just it's because it's not about them. It's
Yeah.
about you, and it's about how you handle other people.
Yeah.
And you size people up. They're big, they're small, they're round. You need to kind of figure out what you're about to encounter based on what you've been through.
Yeah.
Even old guys sometimes have old man strength, and they
Yeah.
can mess you up because they know stuff. You know, they've been experienced. So don't underestimate anyone.
See, I've never.
even girls.
I'll tell you a story. When I was
Even
there too,
girls are
there
strong
was-
sometimes.
There was a 14-year-old
or
or
they have good
15-year-old girl.
technique and they'll get in there and they'll submit you in something you've never seen before.
So have you rolled that girl? So at Orlando's place, there's a 14 or 15-year-old girl, blue belt. Okay? And I remember like
Strong,
you have to
athletic.
roll, like go and then get in their guard. And this girl's guard, I went in there. This 15, 14-year-old girl, because I was like, oh man, this little girl, like, what am I gonna do? her leg strength, I could not
leg strength
pass
is
her.
similar.
I was trying to get in,
Right.
and then clamped in. I could not get past. And at first, because I was like, oh, this little girl, everyone thinks that. If someone's gonna roll with you, like, all right, maybe I should take it easy with you, just because.
Well, they should take it easy with Cass.
But you know what I'm saying, right? Like people, like when I started, like I should take. But after I was trying hard. I was trying to dig in her leg. No, she did not lay up. She did not
technique.
Like, yeah, it was
strength, technique.
Yeah.
There's some.
It was technique for sure.
Yeah.
And I mean, it just again showed that it doesn't matter, like your size, what you like, strength. It is technique. It's definitely technique.
Yeah, 100%.
100%. It's
interesting because early on you can use your strength, but it doesn't last long. And then you get tired and you're like, oh my God, I'm helpless when I'm tired.
It doesn't at all.
So as soon as you learn a little technique and then you kind of learn how to reserve your strength.
Yeah, of course.
Then you start getting better and then you start learning more positions. And
you're less spazzy.
Less spazzy, right?
Yeah, that's a great word.
Yeah.
You're right. Because the struggle of like, oh my God, like that, I would hold my breath. And I know you shouldn't hold your breath. You got to like, breathe, just breathe.
I learned breath work because of him. He's like, just if you're on the bottom, just don't, just breathe.
Don't panic.
Like, don't panic and don't panic and don't tap. It's like, just let the time run out and that's it. Obviously, like if it's somebody bigger, then that's
you
a different
have to
story.
tap.
But
you can just last through a lot of things that you think you have to tap and just calm down. You just like focus on your breathing. It's uncomfortable. You're like, do I need to tap or am I just uncomfortable? And a lot of times you're just uncomfortable. Like,
I'm uncomfortable with my balls in my face.
Yeah,
so
balls on you will get you.
I'm going to tap.
And then get a little breathing room, hold your breath. It's like sometimes things just
breathe
suck.
And
then guess what?
Wow.
If I just give it 30 more seconds, now you're 30 more seconds tired.
Yeah.
And then your muscles are a little more weak. And then I can kind of get a little more room.
Yeah.
And I can get my arm in there and then frame. Right? It's just like little steps.
Yeah.
So it's like an interesting game because it can be these big movements, or it can just be like inches. Like I just get a finger and like kind of get my hand wedged in the front, whereas before it was in the back. Now it's kind of wedged a little bit in the front, and then just kind of like prying it. So it's cool. It's like an interesting game.
Yeah, of course.
And it goes back and forth.
No, that's
it's like call and response.
It's chess, bro.
Super cool.
It's straight chess, not checker. It's straight chess.
That's why I'm just so upset that you gave it up.
No, well, again.
But are you going to come back?
Yes. When you're a black belt,
I'm going to teach you in my school.
I'm going to be your first
I'm going to
student.
start at a school when I'm a black belt.
Mike,
You'll be my first
Listen. When he's a black belt, I'm his first student.
We're going to start a school.
I'm in. I'm down.
For sure.
I'm so down.
Jiu-jitsu is like growing.
Yeah.
It seems like a basic life skill you should know.
I think it's very important.
Can I show you my films that I've been making? So this is the...
Another news.
Please, let me see Mario. I got to see this.
I'm going to show you which one.
How many views so far?
Do you want to see Mario's
Wait,
Lambo?
how many views so far? I want to see this.
There's like 35 views.
Hey, that's how you start. Bro.
Do you want to see?
Don't stop. Yes. Oh, does
you wanna
a
see
fat kid love cake? Let's go. Yes, I want to see it.
Do you want to see Mario's Lambo or Mario's
Lambo first?
And Pickle Rick. Okay.
First Lambo. I want to see a Lambo first. Okay, please show me.
I'll watch the playlist. There it is.
The music. You have the. You are.
You know it, guys.
Oh, is that you?
Yeah, dude. And my kids. We made this one. Like. Guys,
oh my god.
Boing, boing, boing.
Yeah, I knew you'd love it.
Oh my god.
Look at that.
Boom. Pow.
It's the little poop. It's like the poop.
Pickle Rick. I love pickles.
That was Max.
I'm Pickle Rick and
He wanted to do Pickle Rick.
Max is
He's
so
like, everyone,
cool.
I want Pickle Rick in every video. So he knows how to do voiceover now. So I showed him how to do voiceovers. He did the voiceovers to this. That's on our Stone Family channel. At Stone Family channel. So we have this one. We're doing all of our videos.
Send me the link. I'm gonna
See
follow.
Mario's Lamb?
I'm gonna follow.
Subscribe, please.
I
Subscribe
will
to Stone
subscribe.
Family channel, please.
Subscribe and like, guys.
If you have kids and you like to watch fun videos, I
I'm
make
in.
these with my kids.
I'm in.
So watch this one.
Was made possible.
Like I made this one with them.
And their voice is so good for it.
Yeah, it is.
Yeah.
Hey Mario, what's up, man? Pickle Rick.
Is that you? Hey, Mario?
Wow, man, that looks nuts. I'm out of here.
Yeah, dude, it's me. But I did sound effects. I used the mics. And, like, watch. Like, Mario runs away.
Oh my god, he did the jump too. That
Like, how cool is that?
that's pretty cool.
Watch.
Yeah, man, I'm Pickle Rick. Yeah, we meet him.
Is that you?
Good job, man. Good job, Pickle Rick.
I hear the voices. So I was just messing around, man. And I was like,
Mike, I
let
love
me.
you, dude.
I was just-
fucking
I
love
was-
you, bro.
I was trying to
so
figure
funny,
out.
man.
All right, I just finished showing you.
waiting there on the corner.
So-
It started because Mikey, the older one, he was making
Oh,
little videos like with his jets and stuff.
Yeah.
And then we
He
just
he would take his jets and kind of hold it up. I'm like, yeah, Mike, you could probably use your iPad and then use iMovie. So he uses iMovie to edit, and so he'll take a background and make it look like it's flying.
That's smart.
And then kind of do a voiceover, so
Yeah.
he understands how to do production, and he's just using his toys. And then it got me thinking. I'm like, he knows about stop animation. He's like, oh, it takes so much time and this
Yeah.
and that. And I'm like, does it really? Like, let me just try to mess with it a little bit.
Yeah.
And so I
Let
started getting
Dad
his
get
toys out and
involved.
stuff.
Yeah.
I'm like, oh yeah, playing with toys is actually really fun. So I got his good toys out. I
it's a
started
lot
making
of fun.
sets. That's what all this is right
Yeah.
here. This is my next one. I'm gonna do like a little Mario racing around and avoiding a giant shark.
Let's clarify. We're not playing with toys. We're
playing with toys.
We're
This is work,
we're
folks.
building.
This
we're
is
building
work.
toys. It's different. Okay.
Yeah.
So I read graphic novels,
Me
not
too.
comics.
I've been reading X-Men.
Really?
Yeah, X-Men.
I'm reading
The
a
original
book.
one though.
I'm reading a book right now. One of the providers I work with is he's trying to make a movie. He wrote a book that I told him like you can make a comic book, and he's doing it right now, a graphic novel. He's doing it.
Is he doing the art?
He's doing it all. No, he has someone do it.
Is he doing the storyline?
Everything. And I'm so impressed
He's
by
doing the
what he
writing.
did. Yeah, and he has great connections to get to people, right? And he's doing everything like that's what I appreciate. Like, of course, you're saving lives. I'm working as a nurse, whatever.
Saving shoulders,
but
dude.
yeah, whatever.
improving
but
lives.
work is work, right? But then what you do out of work, like this guy is making. He has a whole thing going, and I'm like, I'm gonna support you, dude. Yeah, he put on. I was like, I bought it, and I've been reading a chapter a week because there's
What's the book called?
Eastern Vengeance. Okay,
Eastern Vengeance.
E-
Who's
Eastern
it by?
Vengeance.
What's the author?
It's his
can
name
look
is
it up.
Chris Z, I think it is, but
Brought to you by Chris Z, yo.
He just did it right now, and it's pretty good. It's very graphic. It's like
What's it called again?
Eastern Vengeance.
Eastern
Yeah.
Vengeance.
So the reason I'm reading
It's a
chapter,
graphic novel.
No, it's a book first, but he's gonna make it into a comic book. Yes, that's the one.
Who's the author?
Um,
Chris Z.
yeah,
Z-I-E.
yeah, ZIE.
That
And
looks really cool, actually.
and the storyboard, like I could picture,
Let me find
I
it
could
here.
picture
I'll
it
pull
being
it
a
up.
video game, a comic book. There's so many things that, and the thing is, he's trying to make a movie. And the thing is, like, I appreciate it because he wrote everything as a provider, working. You know what I mean? And that's what you're doing right now. Like, I think that's what you should do.
So what does he do? He's a novelist.
No, he's a pain management doctor.
Oh, really?
Yeah,
Wow.
and
And he's doing this on the side
dude, Mike.
because it's his passion.
Mike,
Amazing.
I
love it.
He's gonna make a movie. Like it's gonna
Really?
it's gonna be a comic book,
That is so cool.
dude. I'm telling you right now.
I want to meet him. Can he come on my show?
You want me to?
He should come on here.
And can I tell you?
Is he a pain management doctor?
Yeah, and
That is a great idea.
But can I tell you, Mike?
We should have him come on my
Mike,
show, right,
Mike,
Cass?
Mike,
He can come talk.
Yeah.
And
Let me tell you
He can
about
show
this
me
guy.
all of his stuff.
let me
here.
let me tell you about this guy. Okay,
All right, I'm gonna look him up. We're gonna show him.
I'm
right
gonna
here.
brag about him a little bit
Let's do
because
it. I'm gonna look him up.
I work with him.
Does he have an
today.
Instagram? Chris
I could-
Z, you need to have an
I could
Instagram.
tell
if
you,
don't.
he probably does, but I don't want to put him on blast yet. But I
So
will.
it's Chris Z,
It's
like that. Chris Z.
Can I don't want to say his name.
No, it's fine. I just want to look up the novel. You don't have to tell me about the guy.
No, the full name though. Oh, but yeah. That's his
His pseudonym.
his pseudonym.
That's
Yeah,
okay.
Yeah.
You don't need to tell me the guy, but we can. If
No,
we
hey,
arrange
he
that
would-
later.
But tell us about
love
it.
So this is what
So-
it looks like. Eastern
so
Vengeance.
I'll tell you
This
about
is it, right?
Yeah. So
that looks so
the
cool.
reason why I appreciate what he does.
So what's the story about?
Oh man.
Did
So
you read
so
this?
far no, I'm on the 5th chapter.
That's so cool.
So it's a really easy read. The reason why I don't
Step into a shadowy, dangerous streets
you
of
could
modern
finish
day
it,
Kiev
you,
with
one
Eastern
day.
vengeance. Hang on, let me read
Yeah.
this. Meet Taras, a driven accountant thrust into a world of violence and betrayal. Entangled in a sinister web of corruption, he navigates a city where danger lurks at every corner and morality. That is that mortality is a luxury no one can afford.
Yeah. So I'll tell you about this guy. He's
Sounds
one,
awesome. I
He's
like the
one of the
writing.
busiest providers. Okay,
Just published
one
last
of the
month.
busiest, right? And why I think it's so cool because he's doing stuff that he doesn't need to. Like he's already set, you know, but he loves doing side stuff, and he's doing this. And I love the fact that he wants to do all this stuff, and you know, we talk about it, like, cause I'm a real geek, right? About Comic-Con, all these things, and we talk about it. Like, he's gonna make a graphic novel. It's already an audiobook for this right now, and then he's gonna go into toys. He's gonna push this whole thing because he has a lot of connections, right?
Has he done that before?
No, of course not. But
But what gave him the idea to do all that?
I actually asked him, and someone told me that during the pandemic, he was doing something overseas, and he was stuck in an area, and he's like, you know what, I'm gonna make a screenplay or a book, and he just did it.
That's so cool.
So when I'm reading this, I can't help but think about his voice, and the fact that he put that on paper. I know, look, a lot of people are gonna hate because he even said like,
hey, why?
No, because
it's so cool.
No,
if you make a good movie, I feel like it doesn't matter.
No, but see, you and I
just make good content.
No, but you and I are different. Like, I think it's cool, but everyone around us are like,
everyone.
They're like, oh,
actually,
God, that's stupid.
No,
why are you gonna
that's
do that?
Perspective.
Like, yeah, like like I'm just saying. Like for me, I appreciate stuff like that. Like,
don't pay attention to those people.
No, of course I don't, but he doesn't either. But
you can't.
I appreciate people that
the people
do
who
that.
are successful just go like this. La di da di da.
Yeah.
I'm gonna do this. I don't care what you say. Gonna do my work right over here.
Yeah.
Because I know it's awesome.
But he's one of the busiest,
he's a visionary.
One of the busiest providers.
That's cool.
Okay.
He's a good and he is,
dude.
you know,
He's one of the guys that
a lot of stuff.
If I had issues and he needs something, I'd go to him because he's so super focused. That's why he's able to do that. That's why I was talking like, where do you get the time? He's so busy. You know, think about like your doctor you work with doing all that, but writing a book and trying to make a movie and imagine him. You know what I'm talking about?
Does he do a podcast?
Huh?
He should do a podcast.
I mean, but you know what I'm talking about.
He should come on.
Okay.
Though. He should come
Imagine him. And can I tell you? So, let me brag about Cass a little bit for a second.
Please
for you.
do.
Yeah, because I don't think you understand.
I think she's wonderful.
Well, we all know she's wonderful, but let me brag a little bit, okay? You know, the provider she did work with, I never heard of him going out doing those things with you. That was not a thing.
And he's talking about like taking the staff out
no,
for dinner.
I'm sorry. Like I don't want to. I don't know how to say this, right? But that was the first for me. I've never. Mike,
taking the staff out for dinner.
Mike. We're talking about. I've worked with him from 2000 till present, or when we left. Right when I left. All those years, never have I once heard about that until her. Okay, Mike. I'm telling you.
I don't even know what you're talking about.
I know. I don't want to say that. That's why. But I'll tell you. I'll tell you later. But.
So tell me how great Cass is.
Well, no, she's detail oriented, meaning
I know that.
if you know, like, if
is that
she
a good
works
thing?
with you, it's very. I think
it is.
As a scrub tech, it's extremely important to be very detail oriented and know the preferences of the doctors, right? But this certain provider, it's like I was shocked to hear that, and she was the one that made it happen.
She worked with him?
Oh yes.
Ah.
Do you know what I'm talking about?
No.
Okay.
Yeah,
We'll
the
talk
one
about
that
it.
I worked with for a long time.
Yeah, she was the main one.
A surgeon.
Yeah.
Oh yeah.
And
I know. Of course.
But Mike.
He's an orthopedic surgeon.
No, but Mike.
He's excellent.
But Mike.
Right. He does total hips.
All
over
the years. We're talking about people that work from.
He's established.
We talking about people that work from years.
Uh huh.
She works for them for a good year.
Yeah, he loves her.
Yeah, exactly. And
she's great. She's
yeah,
great.
Yeah,
She's
it's
the
not
best.
just yeah.
Of course.
It's
He
I don't know.
recognizes talent.
Yeah, but there's a bunch of years. You understand
What?
that there's other people that work with him that were great too.
He gets
But-
grumpy about certain people, but he likes her.
But
And
I'm telling
that's
you,
all I
it's
care about.
so crazy that she was the one. And then when I hear about like what, he's normal.
He is. No, he's cool.
No, but bro,
we're friends.
No, you are,
Yeah.
bro.
He's gonna come on the show.
But I think it's
Is he really?
He will.
But I
should have
think
him
it's
on, right, Cass?
because I think you should.
Yeah.
But I think
We
it's
can talk about photography.
because
bro. See, that's what I know. See, that's what's funny.
That's pretty good.
No, but yeah, I know exactly. Are you into photography?
Of course, I'm into production.
No, but
I am actually.
No, but,
big time.
No,
But I'm learning.
No.
And I learned that about him, and I was like, wow, that's interesting.
bro.
That's cool.
He's into
I want to learn from him.
the lenses.
I learned a lot
The type
from
of
him.
diesel LSR.
I can't say
whatever.
his name, but
No,
Dr.
but-
P. We'll call him Dr. P.
God, you said too much.
We'll call him Papa P.
No. So but that guy. You know why I have so much respect for him?
Yeah.
I mean, there's so many reasons. I mean, he can be very brash to people, but if you're in it, because I scrubbed them for many years.
Really?
Yeah.
I didn't know that. That's so cool.
And then I
that's
also
cool.
circulated.
That makes sense
No,
why
I
you
circulated.
you know
But then
him so well.
but then seeing what she did, I'm telling you, it's
impressive, right?
yeah, it's impressive.
Well, it
But
takes
then-
a lot to be a tech and to be a nurse and to work with surgeons repeatedly that are
with
really
him-
grumpy.
No, but
and
with
we're
him-
academic and we're trying to do like research and we're trying to help patients and then we're busy.
No, but
and
with
we're
him,
all
it's very
grumpy
it's
and,
very
you know, it's
particular.
just like
It's
exactly.
particular. It's
really hard to do.
It's very
like,
particular for him.
really
okay?
hard to do consistently.
Yeah.
And so if people show up consistently
Yeah.
and do a good job consistently,
Yeah.
then you're good. You know,
Yeah.
and he recognizes that.
But
And
that's
so
why-
I was like, okay, well, if you like her, that
Bleep that out.
bleep that out.
Bleep that out.
Hey,
Please.
bleep that out.
I mean, I remember going to a Christmas party
Uh-huh.
to his house. Dope house. Great guy.
Yeah, it's like
so
down
many
the
people.
street.
So many people. Dope time. I had a great time.
I've never been there.
Um,
If you're watching, please invite me to your house. I want to hang out with you.
and I have a lot of respect for him because the thing is, like, you know, there's people that you work with that are fake, right? With him, I know what I get. Like, he's straight up. You know, it's no bullshit. That's why I respect him. You know what I
Right.
mean? And even scrub with him. So he, of course, he didn't remember this, but when I first started scrubbing, he yelled at me for
Did he throw
30
anything at you?
Oh my! I'll tell you, we were doing DHS, right? And then I was telling the numbers, and this is when I first started out. And then he's like, "What number is that?" And then we put the lag screw in, but I didn't replace the component to it, right? And I was like, because he didn't tell me. Because usually I'm like, yo, people just take it off. He just went for it. He just kept going. Like, I go, hey, that's not the lag screw. That's the trial. He's like, what? And he already put the screws in. I was like, is this a new technique? He's just going. I was like,
It's me and Jose.
Like, I was just like,
me and
hey.
Jose are like that.
He's like, hey, I'll let him go. Is this a new technique?
It's interesting because it does. Sometimes it makes things better.
No, because I was like, is this a new technique?
Yeah.
I don't know what's going on.
Yeah, yeah.
And then he's going. I was like, what do you? That's not the lag screw. He's like,
Yeah.
he straight screamed, and you know what he's doing? Pull
Did
out,
he kill
and
you?
every screw he pull out. You better know this number. And you know what I did? Like, I put it all back.
Yeah,
So
yeah.
the lag screw, and then
That's so
every screw,
funny.
he didn't even look at me. And put it
That's
X-ray.
totally
And
neat.
guess what?
Crazy like
the
that.
X-ray
Yeah.
was perfect
It's
because
perfect.
I made sure every screw pulled out. Like, I made sure every screw pulled out. And because
Are you OCD?
Hey, he didn't even look.
Are you OCD? Do you consider yourself OCD?
No.
Are you still crazy like that, or are you calm now?
Because
that's pretty crazy.
Certain things, but when he yelled at me, I
Yeah.
was like in my head, I'm like, all right, fucker, all right, I'm gonna make sure you don't say shit after this. Pulled everything out, put the lag screw in, and then screw, and I was like, and I made sure that each one he put in, what extra came out, is good. And after the case, he came up to me and said, I apologize for yelling at you. You know, like, he's that guy, and that's why I have so much respect for him, because he could be such an asshole, but
And
then,
I think, you know what, kind of like me, like, I guess how I proved to him
Yeah.
that I was like, and I think since that day forward, like, that's how I got stuck
Yeah.
working with him. Not stuck because I liked working
Yeah.
with him, but it was same thing. Like, We were doing a total hip,
Yeah.
and
Did you fuck up?
no, but when we went to
it was
take
never
an
biased.
X-ray, he asked me every single trial size that was in there to see if I remembered.
See, he does that.
And I literally
does
told
that,
him
dude.
every single thing, and
Yeah.
he's like, and he didn't even say anything. And then since that day, like that's where me
Mike.
and him worked together all the time.
So, Mike, let me tell you another story about him. He would do this to people. When I was working for regularly, it was good. But whenever I had someone training, he became extra assholey, extra dicky, just extra. I'm like, oh, he's just acting like this. He just, it's because you're new. He likes to test people. And one of his aim things that for me, not for you, but how much time on the cement? And I knew, right?
He has to dry it.
Oh, he was like, how much time? And right when we put in, I always look at the clock. How much time? 30 seconds. Right away. How much time? Minute 30. Like I would always, and then after that, he knew.
Did you know there was one thing I learned about mixing cement with antibiotics that I learned from the total hip and knee guys? You're supposed to not mix the antibiotics in.
What?
You wait. You mix the polymer with the cement first.
What?
And then you add in the antibiotics. So you should separate it, and you should add in the polymer first.
But where is that? Because that's all we do.
Have all the antibiotics separate. So 2 separate trays. And then you slowly add in the antibiotics.
While it's forming?
While it's forming. It makes so much sense because if you just dump all the chalky antibiotics in, it gets real chalky, and you just have to add saline to it.
But then you need 2
much.
people to do that because it starts to...
You just have to separate it. And then as you're mixing it, open it and then add the antibiotics into the mixture.
So
have the antibiotics as a separate mixture.
So
they
I never
showed it at
knew
Grand
that.
Rounds. It actually.
Oh really?
Yeah, and because
interesting.
I was always getting so clumpy, and so I told Jose, or I haven't told Jose, but Jose, if you're watching, mix the antibiotics later.
and by the way, can I tell you?
These are little tech tips, right? It's
Jose,
like tech tips.
Jose,
we should have a show on tech tips.
I do.
That's
miss
a good
you,
idea.
Jose, because
We should have a show called
Jose
Tech
is
Tips.
Jose is a great tech. I want
Brought
to
to you
know,
by Jose.
Jose, if you see this,
Jose's
you
on the
probably
A
won't.
team.
But
Jose's part of the A team.
Jose's
Geb's on the
Jose's-
B team.
And you know what? I was there when
Geb,
Jose.
if you're watching, you're
Hey,
on the B team.
you know what? You know when Jose started?
You know that.
Jose
Kevin's on
started
the
when
A
he's
team.
21. Okay, he
Yeah,
started.
but he's like
seriously
22 now.
But hey, he
24.
So the fact that you got him so early, like
Yeah,
he's a
just
guy that
mature.
he's a guy
I'm
that
gonna have him on once he's a mature boy.
he's such a good tech because
He's
he's detailed.
amazing. I love him.
Also, he'd be a great nurse. I'm telling you, he'd be a great nurse. He's so good. And
Do you
he
like
cares.
being a nurse?
Do I like?
Did you like being a tech better or being a nurse better? Because I don't know a lot of people that were nurses and techs. What did you like better? And as far as the overall, was it better being a tech or a nurse?
Honestly, I probably like being a tech more.
Tech more.
Yeah,
For day to day.
Yeah, because whenever I was a nurse and I was able to scrub all the time, assist, orthotech, relief, I just loved it. The only reason I became a nurse because I was trying to go PA school, and it was just felt like the natural progression. And but if it was up to me, I would have kept being a tech. I just kept on trying to go. You know what I mean? And I know a lot of scrub techs. I can name freaking 10 that are the best, and they're living the best life of their lives right now. But they are the best, and it's just for me, just a progression. I was like, I was already going to school. Like, F it, I'm gonna keep going. But you can make great living as tech, but I just kept going because I was already trying to go PA school.
So is this the last chapter of your career?
Hell yeah. I will never. I do not like the running joke at my place right now, and even the OR before was. So there's different levels of nursing within our company, right? CN1, CN2, CN3, CN4, then A&M. Well, you keep going, but usually in nurses like CN1, CN2, CN3, CN4, and each one you progress.
What does CN stand for?
Clinical nurse. Mm-hmm. So everyone starts as a clinical nurse 1. Then you go to clinical nurse 2. Then 3 and 4. 4 is more management. 3 is like you're up there, but you can take charge, whatever. The running joke for me, for ever since I've been there, I'm a CN2 for life because I felt like the time you put in, you're gonna get there, and so I put my time. I'm not all about doing extra projects. I don't want to do extra like, hey, I'm gonna do my job. I want to, like, when I leave work, I don't care about work. My life is more important. My time is more important.
Is there going to be a point where you stop working?
Yes,
as
100%
day to day. And so what's
100%.
next for Andrew Kim? What's
next is
what's the next phase?
There's a lot of things. I don't want to say too much.
But what's next? And then
next is I'm gonna continue this because where I'm working right now is 100% a retirement job.
Right. So no, we're saying you got your benefits. They're paid out. You're done.
Oh my God.
We're on to the next.
So
we're done with that.
One of the life goals is for sure. I want to get my amateur card in golf. Like, I'm not joking. I just want to get that card and I'm good.
Okay. So where's the next place you're gonna play? That's the next major green.
I mean,
Pebble Beach.
I mean, dude, I've already played at.
Where's the place
Half
in
Moon
San
Bay.
Diego?
I played at Half Moon Bay with my cousins. That was awesome, but I wasn't when I played there. I wasn't
Half Moon Bay
where I'm at now, right? So I wish I was at where I was at now and played there. But there's so many courses, like all the PGA courses I would love to play. But to get that amateur card, like if I retired now, like Camille knows, all I want to do is play golf. Like I would try hard
golf, yeah. So you do that for a while.
Oh, dude, 100%. That's where I want to go. But for finances, like I would probably, there's a lot of things I'd probably do.
So what interests you next? Do you have any more hobbies or?
Golf is completely.
You can do that for a while.
Completely taken over, but also me and my friends want to do a channel. We've been talking about.
What kind of channel?
Food review stuff. We just been talking about the whole concept.
What's that going to be about?
It's gonna be about happy hour. The main thing is like
in which areas?
That's why we're gonna divide
local stuff.
We're gonna divide certain areas to do happy hour, and I feel like
I love happy hour.
I feel like
there's a happy hour, and I'm there. I'm like, yes, I made happy.
No, but that's why I think that's
at least have wings and a beer, and I'm good.
That's why we want to find the best happy hours.
$5.
Yeah, exactly. We want to find the best happy hours because I don't think it's out there right now.
And like rate them and then like recommend them.
And
that would be
that
would be a great
idea.
thing. Yeah.
So, do you guys have a?
We have a name right now.
You don't have to put it out if you guys haven't already done it.
Well,
have you guys already put it out there? Then don't put it out there. But what's your Instagram or what's your handle for your? Do you have any YouTube?
No, but I don't care.
I know that.
No, I'm not.
Do you have any MySpace? Or
no. I know I'm that old, bro.
You have a Facebook?
But fuck you, Mike. But did you AOL? Andrew AOL.com. This dickhead. Like,
I was watching Bill Murray talk to Joe Rogan. He had an AOL.
Hey, bro. I just saw that one.
Yeah, it was good.
Bill Murray.
Send it to my dad.
I am a big fan.
Like, Dad, this is what a podcast is, and watch Bill Murray.
Fuck you, Mike. Bill Murray.
That's good. I love Bill Murray.
I love Bill Murray.
Yeah.
My
dad could relate though.
That documentary, Stories of Bill Murray. Have you seen that movie?
No, what's it called?
It's called Story of Bill Murray. Okay. Stories of Bill Murray.
I love him.
The reason why I love that documentary because it shows Bill Murray. There's videos of him going to bachelor parties, weddings, just hanging out
there like
random. Like you're in the back. Is that Bill Murray? Like,
he likes when people don't know who he is, and he hangs out and has fun.
He hangs out with these people.
And they party with them.
He's been at wedding reception, and they're like,
he's like a wedding crasher.
They're like, who is this guy? Yeah. Bill Murray's on my wedding. I appreciate that.
It's so good.
That's dope.
He gifted Rogan like a shirt and some shorts.
Yeah.
And I guess it's like his brand, right? And so Rogan was like, "Oh yeah, so where can we get these?" And he's like, "I don't know, like a website or something." And it's like, it's your brand.
I'm gonna buy shit.
He doesn't even know. He didn't even know what Rogan's podcast was.
Yeah, I know.
He was just like, "I have never heard your show."
He's
done like 2,000.
No, AOL.
He didn't even know
he has AOL. He just got a phone, and before that, funny. What I knew about the history of Bill Murray, he has an AOL account. and he has a number. So people have to email him or leave a message.
Yeah.
And that's how he
probably
gets
responds.
Yeah,
too.
that's the only response.
That's
but then he
hilarious.
recently got a phone for his kids.
Right.
So people call.
They
But
broke it
that's
down.
how you do it. You have a voicemail on his voicemail machine, and that's how he is completely disconnected, which I
Totally off the grid.
respect so much.
Well,
In this day and age, like that's
you have to be
impressive.
off the grid, but you're either all in or you're all out.
Yeah.
But he's off the grid and still relevant.
Yes.
So that's
He's-
crazy.
he's 100%.
And he's so sharp. He comes on, he's like right where he used to be. Dude, he's so funny.
I really adore him.
Especially it's like
he's
old
one of my
school, new
favorites.
school. It doesn't
He's,
matter.
He's one of my
funny.
favorites for sure.
Oh, yeah. All-time
Like,
favorites.
have you seen Caddyshack? See,
Caddyshack.
Cassandra, you have to see Caddyshack. You
We'll
have to see
watch
that.
it. We'll watch it
You have
tonight.
Caddyshack. You
Well,
have
let's wrap this show up. We can watch Caddyshack. Dude, it's been so awesome having you. I respect you. I love you as a friend. I just thank you for teaching Cass so much, because I think she's a good person, mostly because of
100%.
you and because of her mom. Those are the two major influences
Oh, wow.
on her. So you're
Holy
right up there with
shit,
her.
that's-
I think there's a lot of respect that goes across.
That's a
It's-
massive. Oh my gosh.
It's like
so much
work.
responsibility.
It's like who do you respect at work? Andrew Kim. So she was so happy that you were coming over. We
Holy,
could catch up, and I've just
geez.
it's been really fun
Mike,
talking to you, catching
Yeah,
up, man.
Mike. Yeah. Wow. That's from a bench player, a replacement. Thank
Fresh
you very
off
much,
the
Mike.
gas,
I
yes.
appreciate it. All right, great. I'll be happy to come out anytime, please.
So you're the guy I can call, right?
All day.
Perfect. That's what I need.
All day because
I need a go-to.
Actually,
You're my go-to
it's-
guy.
I'll be the go-to guy because I just want to hang out. Honestly, this is a side
What
gig.
do you think about production? Because I need somebody who can help me with like production.
You know
Can you
what?
help me like turn the record button on?
Can I tell you,
That could help
if
me.
you need this help, I'm sure Camille's
Are you
down.
looking for another gig? Will Camille let you? Will she let you out of the house?
Probably. Oh no, she don't care, and she actually.
Because you could come over
Hey,
and help me.
hey,
and we could play Mortal Kombat.
Yeah, so-
we should stop this and go play Mortal Kombat.
Stop. Look, we're talking about work, okay?
Yeah.
Stop
No,
what we're gonna do on the side.
oh, sorry,
So
sorry.
please.
Yeah,
What
sorry.
are you saying? Okay,
I
bro.
meant MK.
Yeah. Okay. We're here
MK,
to work. Okay. We're here to work. But Camille, she loves you so.
Well, I love
I mean,
that.
the fact that she volunteered me, she knows that I'm like,
Hey,
all right. Yeah,
we
I
all
mean,
have to be careful because Camille's around and
Yeah.
probably watching.
But
Camille, I love
she
you.
she does
And
she
I
really
love
does love you, and she's like, yeah, you need to go. I was like, yeah, I'm gonna go.
I
But
knew that. I could tell
Yeah.
the urgency of your text back. I was like, Camille, Camille, let him go. He seems very eager.
Liar. He's a fucking liar. Okay. Don't hear anything. He's a fucking. But he heals people. He heals people amazingly.
Well, dude, it's been real fun, man. Well,
course.
this is the third episode of LA Shoulder Podcast.
But I'm in.
And that's all, folks.
I'm the bench.
Thanks
Okay.
for coming, man.
This was a fun one. This was a fun one.
Alex, come in the bench.
That's all, folks.